All right, good morning, everyone. Good morning, and welcome to our seminar with Dr. Sonya Doherty, Autism 101. Let's start by thanking Community Living Thunder Bay for sponsoring this, and Maureen, all the work you've gone into making that happen. Thanks so much for doing that. And thanks to Dr. Sonya for joining us here. So you're going to see over this next couple of hours why Dr. Sonya has been such an incredible resource to us at Center for Conscious Care. She really helped twig, in some ways, develop our model, which has got two fundamental components. If for those of you who are not aware, we teach folks how to be mindfully, emotionally self-regulated, supporters, moms, dads, whoever, so that in crisis or whenever they can keep their cool, keep their upper brain online, and continue to give competent, caring support. We see this as a really great need in the sector. And for all those of you that are in it, you know what we're talking about here. And the second leg of our conscious care and support model is looking at this biomedical comorbidities that cause so many problems with so many kids and adults with autism and other developmental disabilities. And Dr. Sonya's got a great expertise in this, as you're going to hear today. And you've read her bio, so I'm not going to repeat on that, but I'll just give you just a quick cut of comments. She really is a pioneer in Ontario in this area, as you're going to see. We're just so pleased that she's with us on this. You're going to see how valuable she is in terms of the expertise she brings. But what you won't see today, you may hear a little bit of it is her equally high levels of not only competence, but caring and compassion. And it's just such a beautiful blend to have. And that's why she's been such a valuable resource to us at Center for Conscious Care for what, Dr. Sonya, over 10 years now, I'm thinking. So
that's all the gray hairs.
So with that, Dr. Sonya, how about I just turn it over to you, okay? And welcome to our team here.
Thank you so much. I think like many of you, I've learned so much from Peter and the Center for Conscious Care. And so I'll ask you, Peter, if you can keep me on track, because I do see through a pediatric lens as a default, right? So I just want to make sure that doesn't, nothing gets missed. So please jump in. And I think, if anyone has questions or wants something clarified or wants to go into more depth on something, I think we're going to kind of have this to be a collaborative, interactive. So please let me know if you have any questions or something pops into your mind. And yeah, with that, I'll just kind of jump in with what I always start with, because I learned this actually from, I have two PowerPoints, so I will sort of switch back and forth from them. And but what I always start with is this concept of presumed competence, right? And when we look at presumed competence, I think it's really, really important that we apply this to the medical information. And so I use that lens because I was trained as a naturopathic doctor, but most of my training came with the Medical Academy of Pediatric Special Needs, which is a lot of researchers and doctors, a lot of parents of children who do have developmental delays. And so I think from a medical perspective, if you take away the diagnoses, sometimes it's easier to medically assess people without those diagnoses in front of you. Like with autism, or global developmental delay or cerebral palsy, we're often seeing the diagnosis and then saying, okay, well, that's just because of the autism, or that's just because of this. But from a medical perspective, if we don't sort of come with this idea of presuming competence, then we can miss sometimes overt medical issues. And I have, through working with community living in Peter Marks, I have seen these being missed when if the person didn't have a diagnosis, they would have been like, oh, that's for sure reflux, or that person has an infection, or they must have a headache. So it's, I think, dangerous to presume someone's incompetent, that their behavior is just a behavior and may not warrant medical assessment. It's much safer medically to presume that, these are human beings that we are working with, label or not, diagnosis or not, and we need to medically assess them as if we would anyone who presented with these symptoms. And obviously this concept of presumed competence goes beyond the medical realm, but that's not an area I'm an expert in. So, this was actually the artist in our office, our artwork is from a person diagnosed with autism who is described Aspie, and she said, I can't stand actually when we talk about these puzzle pieces. Like, I'm not a puzzle piece. I'm not a game. I'm not something to be figured out or manipulated. I'm as unique as a snowflake, and as we all are. So we try whenever possible to kind of bring the autism voices into our dialogue here. And the other place I learned is from our community of people with autism and developmental delays. So for many years, I didn't really actively presume competence. Like Peter said, I consider myself a kind and compassionate person. I want to always be striving to be better, but this young man completely blew my mind. And having not seen this family for many, many years, they came in, and after the appointment, the mom said, "Do you have any questions for Fox?" And I froze. He wasn't communicating verbally. There was lots of stuff going on from a behavioral standpoint that would make me not really think that he was ready or able to communicate. And so then she pulled out a letterboard, and he spelled, and I try not to cry, but I'm a bit of a crybaby, as you guys know if you've heard me before. But he spelled out, "Do you think I'm stupid?" And I literally just started bawling. Like, it wasn't really even control. I just started crying. And I said, "No, but I didn't know how to communicate with you. And now I do. And I feel very lucky for that." So, one of the working theories for folks like myself is that autism, and this does apply across the board. So I actually use autism as a jumping off point for global developmental delay, cerebral palsy. Down syndrome has a lot of connections to the things we're going to talk about today medically. So I'll try to keep mentioning them as we go. And the medical aspects of the folks that you're working with are something that we can often improve and have a very real impact on quality of life and sometimes developmental potential. So what is praxis? Praxis, as you may know, is an ancient Latin Greek word for movement. And while it's pretty easy to say movement, it actually is very complicated to move. In fact, there are researchers who have spent their whole life studying movement, and they believe that the only reason we create energy is for movement, right? So the reason that we have brains is to facilitate movement. And so praxis is actually quite complicated. So for me to be talking right now, I have to be regulating my breath intake. I have to be sitting. I have to be, using all the little teeny tiny muscles in my articulators, my mouth and my throat. I have to be processing hearing myself, right? And there's not much noise in here, but if I was to get up, I would have to make a motor plan of how that would work in sequence. So motor plans are the sequence of motor movements it's going to take for you to do something. And everything we do in our body requires movement. Maybe not sweating, but I think probably still sweating. That everything we do requires movement, and that is a big, if not, in some people's theory, the only reason we have a brain. So if I'm making a motor plan, it could be 40 steps, it could be 100 steps, it could be 300 steps, 1,000 steps. So when I make my motor plan, it's like a draft. It's like you creating an essay, a draft essay, and then you hand it in to be checked. Except our motor plan, our draft, has to get checked with the sensory system. In the brain, and you'll see a picture of this later, but in the brain, the motor system, the movement system, and the sensory system are connected. And in autism and many other developmental delays, they become disconnected. So when people are making their motor plans, first of all, because of medical issues like inflammation and autism in the brain, their motor planning, their ability to make a motor plan is slower, but they still have to check that motor plan against the sensory system. So like if I was going to get up, I'd make my motor plan and then I check with the sensory system. Is there ice? Is there gravel? Do I have a baby in my hands, right? Is there someone bursting through the door? My sensory system has to okay my motor plan before I make any movement. So although praxis is a simple word, it is not simple. And I think the literature really supports that autism is a disorder of praxis. There is the disruption of both sensory and motor planning, and this is caused by deficient energy production. As you might know, this might go back to some of your early education. I know my kids are learning about mitochondria now, although I've been showing them videos of mitochondria their whole life, which they will roll their eyes at. But mitochondria produce all the energy in our body. So they are the organelles, they are the little organs inside our cells, and we have hundreds and trillions of them. I think it's like 10 to the 17, which I'm terrible at math, so I won't even attempt that number, but it's a lot. Mitochondria make all the energy in our body. And actually, I'll put a note here too. There's a really lovely video that I'll either send or play, and it's just amazing because you can see these sparks of energy being produced within our body. And what I share when I do these kinds of talks, which I'm very privileged and lucky and so happy to be able to share this, because this is my entire life. And I do have a son with autism, so this has changed and transformed our life and his potential. So I always sort of share, when you think about the energy production, it's like sparks or lights, and the people you're working with, it's hard for them to make as many as we can. And so I think it is sort of like I don't know if you want to say it's like it's a human right, or it's a medical imperative, or it's so important. I don't know which words to use, but it's so important that we understand that their mitochondrial production of ATP, which is the energy molecule, it is impaired. And so it is impaired in cerebral palsy. There's a theory that in many cases of cerebral palsy, the mitochondria themselves are weaker coming into birth, and so that the oxygen deprivation is a secondary or sometimes tertiary insult on the mitochondria. So mitochondria we inherit from our moms. It's maternal DNA, which is very interesting. And mitochondria have their own DNA. And they're also really sensitive to toxicity. So when we live in this world surrounded by toxins, and we know that people with autism have problems with toxicity, so they sometimes have higher exposures, but they're more likely to have difficulty getting rid of these toxins that we are all exposed to. So downstream, this impact is low energy production. So we see this in global developmental delay, we see it in cerebral palsy. Mitochondrial impairment is part of Down syndrome. So the genetic trisomy leads to mitochondrial impairment. And of course, it is a hallmark of autism. So when we look at prevention, we need to look at preventing the mitochondria from being negatively impacted. And then when we look at treatment, we're really just trying to increase energy production for anyone we're working with. And the interesting thing about energy production is it impacts all the organs. So if you don't have as much energy, as I mentioned, it's harder to get rid of toxins. You can't manage the microbes that live in our intestine. I think lots of us have heard about this gut-brain connection. The gut and brain connection is both macro and micro. So on a microscopic scale, we have 400 trillion bacteria that live in our intestines. And whoever is in charge of the gut is in charge of the brain. And we do know those microbial abnormalities in autism. And I will touch on that lightly today. But downstream, again, what you're going to get, if you have weak mitochondria, you're going to have more problems with these systems. And then they're going to be further damaged. And this is a vicious cycle that they get stuck in. All speech delay is mitochondrial. All regression is mitochondrial. And mitochondria play a role in seizure disorders. So what happens when you have less mitochondria? You have weakened organ function. Your brain does not function at optimal. Your liver to detoxify even your own stuff in your own body, like hormones. Hormonal aspects play a huge role in behavioral issues, and that's something we can medically treat. I don't consider myself an expert in all adult treatment. I often will consult with my sister, who is actually expert in all things because she's gifted and she can do anything. But we do sort of have a team approach to treatment, because adult bodies are complicated by these hormones that are produced through the body with the help of mitochondria. So neurotransmission is the other one. Our brain chemicals are firing. I think a lot of us, certainly myself included, even after I graduated from naturopathic college, you envision the brain, you sort of envision neurons that send messages along a cord. But actually 15% of the brain is neurons. Most of the brain is actually immune system, and they broadcast brain chemicals, just like your phone, right? Or your Wi-Fi. The brain is like a Wi-Fi system, and it runs on ATP. So if you improve ATP production from the mitochondria, which is quite straightforward, and by the end of today, you'll have a really good idea of how I prefer to go about that for most humans. It's actually straightforward to improve it, and I think it's a really important thing to consider in the people in your lives or the people that you're working with, to see if you can improve quality of life and developmental potential and opportunities. The sort of medical stuff is in here because it is really interesting for you folks who like to dig into the medical literature. This stuff comes from, you know, the cell danger response type of paper by Dr. Navio. There's lots of talk about lipid peroxidation, which is just shredding of the cell membrane. So our bodies are filled with cells and they're balls of fat. And in autism and many other developmental delays, they're shredding. And so then when the cells have the outsides of them shredding, of course, the mitochondria inside can't function as well. It's actually like if you were in a country that was being bombed, right? So lipid peroxidation of the cell membrane. And then of course the brain gets this thing called immunoexcitotoxicity, which might be my favorite word, but it's simple. It's the brain is an immune system. The brain turns on, gets excited, and it gets so excited, it becomes toxic. So immunoexcitotoxicity, and that can apply to things like PTSD and chronic encephalopathy, the stuff that the football players get, and lots of other, you know, probably other people, but they get it from the tackling, and their brain then has those chronic issues. And then it is a proposed kind of central mechanism for Alzheimer's and dementia and many neurodegenerative concerns as well. But the beautiful thing about this is it's medical. And so if it's medical, it's something you can support. And if you can support it, then you can see improvements that often have the ability to change people's lives. So here's some of the TED Talks that encapsulate this research. I haven't read all this research. Sometimes I listen to these and read a few of their papers. Sometimes I'll dive deep, but these are great because they're typically about 15 to 20 minutes long, and they sort of explain in more detail what I'm going to go into. The reason I wanted to kind of switch into my other PowerPoint here is because there's some, I love this actually. I do this the wrong thing. I just bring up the same one over and over, so just bear with me. That's my neurodivergence, which is my brain is a crazy place, basically. Here we go. Yeah, I think if it wasn't for my sister and my staff and people who are organized, you know, like you folks who organize this, then these things wouldn't happen for me. But it's all in there. I just need the visuals to bring it out. So this fascinates me, this paper. So Dr. Leo Kanner's original paper in 1943, I don't know if you've ever read it. It's not that long, and it's actually not that medically hard to read because I'm not a PhD, right? I did my undergrad in a BSc kinesiology. I did a lot of playing basketball at Western. And I love my postgrad. I learned a lot. I love being a naturopath, but I would never proclaim to be some sort of like, you know, PhD neuroscientist. So Dr. Leo Kanner, this is the original sort of 11 cases. And what I found fascinating in the paper is they said that they were medically unremarkable. So I'm not going to read through the whole thing, but case 1, eating has always been a problem, has never shown a normal appetite. Case 2, very large and ragged tonsils. Case 3, diarrhea and fever following smallpox vaccination, healthy except for large tonsils and adenoids. Case 4, vomited a great deal during his first year. Feeding formulas were changed, tonsils were removed. Case 5, nursed poorly, quit taking any kind of nourishment at 3 months. Tube fed 5 times a day, up until 1 year of age. Avitaminosis, low vitamin A, we're going to touch on as well as it relates to the visual processing and the visual stimming that you might see that may preoccupy someone for the entirety of their waking hours. Malnutrition, vomited all the food from birth. Case 7. Case 8, feeding formula caused concerns, colds, bronchitis, streptococcus infection, impetigo. Case 9, no infections, right? So then we're sort of, my theory would be autoimmunity when you look at things like pandas or, you know, an autoimmune attack on the brain, which we also see. I do have a case recently, actually, that I might share. That's quite fascinating. I think might be interesting. So a pandas case with a person with autism who developed pandas later on in life. But, you know, case 11, this is an endocrine thing, which I don't often see, but does this sound medically unremarkable? To me, it does not. And so I think the biggest thing that we need to do in a role as a medical professional, whether it is as a naturopathic doctor or a physician, and I will share, I shared it earlier, but Dr. Wendy Edwards is a pediatrician in Chatham, and she is regarded for good reason to be the top doctor in Canada for autism and pandas. And she's actually now offering consults for other doctors through Ontario eConsult. I have sent to her an email to clarify if that's something that if someone who has an adult patient can still consult with her. I'm pretty sure they can, or if it has to be a pediatric patient. But that's an amazing resource for those of you who are maybe trying to get medical doctors on board, but the medical doctors are saying, well, I'm not an expert and I don't know. Well, we have an expert you can talk to, who's wonderful and very, very knowledgeable. So I think our role has to be looking at these medical issues and, like I said, trying to see past these diagnoses. The reality is it's uncomfortable and painful to live with untreated medical concerns. And that's for everyone. So when someone has more trouble telling you that they have these concerns, it's important that we look for these signs and symptoms, particularly in their behavior or sometimes in their sleep cycles. The goal really is to see what we can do about making sure that people have the most comfortable life possible. But another really important role is that these also will increase likelihood of other chronic diseases. So people with autism do suffer with chronic diseases at younger ages than the typical or neurotypical population. So when we look at sort of this overall treatment strategy, I think the most important, I'd say there's probably three really important things we're going to really focus on, although we'll touch on lots of things today. But this is so poorly understood in the medical community, in the naturopathic community, in the general. Most people don't know, I think, what I'm going to share with you, and it is the life's work of some researchers who have brought us to the point where we can finally understand that these two pieces in here, first of all, if someone's not having regular bowel movements, it's going to cause a major issue because people with autism have sensory issues, right? 90% of people with autism have sensory issues. So what we feel when we have pain or discomfort in our stomach or intestines may not be what they feel. So we could have, gas and it's not a big deal. They could have gas and they might want to tear their hair out, right? I've had patients tell me they can feel when their teeth are growing in or when their hair is growing in. They do not feel or integrate information the same way that we do. And you could have a client or a patient who is, like they're hitting themselves or smashing their head against the wall, or they're scratching themselves till they bleed. And then you think, well, if they had diarrhea, how could that be more painful? But they don't have typical integration of pain. So they can have extreme pain from things that we may not, and they can tolerate pain that they sometimes are self-interest themselves that we would never be able to tolerate. And one sort of rule of thumb that I have you guys consider is that if someone is hurting themselves, the most likely reason is that they're in more pain than that to begin with. So if you're in so much pain, then actually hitting your head on the wall will relieve pain. So self-injury is typically to release the endorphins so that you can manage the pain you're already in. And I think Peter does such a wonderful job of talking about this with the, blowing out or blowing in. And that is absolutely, I would just add sort of to that there's pain in there, and it can be emotional pain, it can be sensory pain, it can be physical pain. Often it's all of it. I have a little guy with autism who's getting not so little, but when he was little, he'd smash his face on the table if you tried to feed him anything but cashews, right? And then later when he did develop language, he told us, he's like, even looking at that food hurts my brain, right? And now, thank God, literally he eats everything, and he wouldn't even put a steak in his mouth 10 years ago, and now he'd eat all the steaks we can afford, which is getting fewer these days, but no. So that's the other sort of element of this, is that long-term mitochondrial support, long-term treatment of the intestine, long-term treatment of sensory issues improves and has a cumulative and ripple effect over a lifetime. So what is fecal loading? Fecal loading is a term that, it basically means what's not coming out, right? So when we first started working with community living, we saw what we thought were behavioral indications of pain due to problems in the bowel. But because the people working in the group homes had taken such meticulous notes, we were able to see that the bowel movements actually were normal over the course of many, many months. So like perfect on paper, right? So number 4s that looked like a hot dog or a sausage, and 2 or 3 times a day looked perfect on paper. But fecal loading is what gets stuck in there. And I'm going to go into this later in detail, but a lot of people with autism don't make proper enzymes. And one of the things they don't make is bile. Bile, as you may know, gets stored in our gallbladder and it squirts out when we eat things like fat, and then it helps us to break down fat. So if someone eats fat and they don't break it down, it's going to turn into a gooey, sticky mess. The other element of not making bile is bile is made of bile salts. And if those salts don't turn into bile, they remain salts, and they remain salts in the intestine. So once we engage in some of this treatment, we will actually see people, kids particularly, like they start pooping out salt or sand. Parents will report it as sand. So they'll be like, I think they're eating sand. Like, I don't know where they're getting sand. There's sand coming out in the diaper or in the toilet. And the sand is actually the bile salts not being produced into bile, not being combined into bile properly. And that hurts. You imagine trying to poop out sand or glue or sticky, gooey stuff. If I could stay awake, I could probably tell you 1,000 stories of the weird poop that's come out. 3 sort of stick in my mind all the time. One is I had a little girl who had a severe regression in around 4 years old, was quite high functioning is not a term I love, but she had a lot of skills, regressed into quite significant severe autism, couldn't find help anywhere. They came to us and I said, well, I think she's got this stuff sticking around here is making her nuts. It's making her regress. She can't make enough energy for her mitochondria because she can't absorb through this gooey, sticky mess in the intestines. And it took a while for mom to buy in. Obviously, like that's kind of a crazy thing to hear when you've been told your whole life that behavior is just behavior. So at one point they went to the ER, and the ER gave them an ultrasound. An ultrasound won't pick up old stool. Old stool, if you guys have pets or you've seen people not pick up their pet poop, it starts to turn white, right? So you have to pick it up on an x-ray. So they gave her an ultrasound. Oh, she's fine. It's just behavior. I mean, this child's hurting themselves, hurting other people. It's something you see probably every day. So then they called me. I said, you need an x-ray. The ultrasound won't diagnose it. Go back to the hospital. So they went back to the hospital. They did an x-ray, and the hospital said that's the most severely constipated child we've ever seen. So through the course of treatment, that child improved. And, you know, the other story is a boy who's, again, had lots of skills, doing well in school, just started throwing chairs, screaming, yelling, swearing, just not himself at all. Parents called me from the hospital. What should we do? Please get a bowel x-ray. Sounds crazy. Please ask them. Hospital wouldn't do it. Eventually, parents advocated and they got the x-ray. Again, severe fecal loading. We started to treat it, which we treat through laxatives, which I'm going to share with you, including the handouts and the specific sort of things like dosing and products. And he got better, but he had to basically stay on high dose laxatives. So finally, the parents were like, this is crazy. Like, he's been on laxatives for 6 months. This problem still is being kept at bay, but only through diarrhea. And so he gets a colonoscopy. And the colonoscopy, they go in. And if you had a colonoscopy, you know you have to have diarrhea for 2 days before. It's really fun. And then if you don't clear out properly, the doctor will actually do an enema and pump water in to pull the stool out that hasn't come out through the bowel clear outs. And they'll often say to people, oh, you didn't clear your bowel out properly. I would say we become more and more constipated as a population. And that's partly to do with our food supply. And there's a wonderful Canadian researcher who I'm going to talk a lot about today because he's just a phenomenal guy. And his research is amazing, but it's about how the food supply is leading to fecal loading. And so, do you like all the Easter eggs I'm dropping? I don't know. It's like, we'll get to it all, but it's a whole scramble in here. But the, so they go get the colonoscopy, and this kid still has stool in there. They do the enema, and then the doctor's like, what's going on here? They had to suck the stool off the intestinal wall. So the other story I have is they went in with an endoscopy. Again, child had all these things going on and trying to figure it out. They went in with an endoscopy because, of course, colonoscopy is through the rectum. For those of you who don't know that, endoscopy is down the throat, and they couldn't get the camera through because there was so much junk in the intestine. So again, if I could say away, I could tell you 1,000 of these stories, but those ones are, I think, the ones that I, like Fox, you know, there are cases and kids and families and people who change your life. And those ones really framed for me what we're battling in the gut. And then being a parent of a child who we've worked with, you know, the stuff that has come out of his intestines was basically like some sort of like sensory horror story, right? That barely could flush down the toilet. So this situation is a lot to do with the gut. I think your behavior is probably, I would say, solid 80%. If I was a little bit more savvy in the adult population, I'd bump it up to 90, 95. But kids, I'd say the parents, 95% of the times you have the behaviors we're going to talk about, there's something going on in the gut. Mitochondrial production of ATP governs motility. So just like I need energy to talk and move my tongue and my articulators and all that stuff, my intestines need energy to move. And the intestine is 18 to 22 feet long. So if you lack energy production, you are going to have a slow intestine. And some of that ends up being the anatomy of the intestine, which I'll show you. So, we often get this sort of like, where do you start in developmental delay? And I think you have to start with the gut. I think you have to start with the gut, because how do you make more energy if the gut has so much junk and sticky, gooey stuff in it that they can't absorb, right? And so I'll say to parents and facilitators and educators and therapists and people working on the front lines like you folks, what if there was a miracle drug? What if there was a miracle drug that regulated immunity, protects against autoimmunity, protects against infections linked to autism like Clostridia overgrowth, strep, and yeast? Clostridia and strep are both bacteria. Yeast is like a fungus that overgrows in the intestine. So when people say there's problems in the gut in autism, there's macro, right? The gluey, stewy stool, the sticky, gooey mess, the hard, crusty. People with autism also don't really metabolize or break down fat well because they don't make enough bile. So then they're not making the energy that they need for the motility in there. And so when you look at these microbes, they overgrow because this situation is like, a perfect petri dish for them to create and cause problems. So then on a micro scale, you get these bugs. And we know that in autism, the ecosystem in the gut, which is called the microbiome, that's the 400 trillion bacteria that live in the gut. There's bacteria, there's yeast, there's parasites, and there's fungus. And out of that, the viruses really are the most important to keep control of the situation. But, what if this miracle drug could detoxify things like lead and mercury that have been linked to autism, or pesticides or fire retardants? What if they can make more nutrients that will make more energy and support cycles that we'll talk about today, decrease inflammation, and improve brain chemical production? You may know this, but I'm really big on context for these conversations, is that the gut actually makes 90 to 95% of the body's serotonin. So one of the first cases that I actually worked in a group on was like a really long time ago. And it was one of the PSWs who came, and she's like, I have celiac. So like, I'm in pain from that. And I'm seeing these symptoms in a person that I work with, and I'm wondering if they have celiac. And so through the course of our treatment, we were able to identify that this young man's bowel was so upset all the time that it was leading to absolutely disastrous behaviors, and the medications weren't working because he wasn't even making enough serotonin. So for your medications to work, you have to make enough serotonin for an SSRI to work. An SSRI, as you probably know, is a serotonin reuptake inhibitor, so it keeps serotonin in the bloodstream. If you don't make enough serotonin, how do you keep it in the bloodstream, right? That's often why our folks have stranger or different reactions than the typical community to these drugs, right? They need higher amounts, or they have more side effects. If there's a side effect no one's ever had, it's going to be in our kids, our patients. So we do have a miracle drug. However we got here, higher power, Big Bang, aliens, evolution, we have a miracle drug. Our body is the most miraculous system on the planet. Our body, if you do believe in evolution, then the suggestion is that for 15 million years we evolved, eating meat, vegetables, fruit, nuts, and seeds, and our ecosystem and our gut evolved with us. Our intestines are 100% responsible for postnatal development. Whoever is in charge of the gut is in charge of the brain. There's thousands of species of different things that live in our gut. My mentor, Julie Buckley, she's a pediatrician down in Jacksonville, Florida. So like every time I have a hurricane, I email her. I'm like, "Are you okay? Like, we just don't have hurricanes here. It freaks me out." But she's a tough lady. She said, your gut will make more decisions in one day than you will in a lifetime. So our viruses in there actually govern the ecosystem in the gut, like a police officer maybe on the highway, making sure people don't speed. The viruses are so important for our patients and kids and clients that we work with, because when the viruses don't have enough vitamin A, that's what leads to the visual symptoms, right? And we'll get there, but again, when we presume competence, why would someone do this all day? Like, why would someone find any string they could and do this all day? Right? If they didn't have a diagnosis, what would you think was going on? What organ would you say, hey, like, I wonder if that's doing okay? Right? So same thing with the bowel. If someone's got diarrhea or they're pooping out little balls, you know, maybe they're pooping, but it smells like rotting death. Maybe they're clogging toilets. It's like, how did that come out of that person? Well, maybe there's a problem, right? Because the diagnosis for so long, especially with the bowel, is, oh, people with autism, they just have digestive problems. First of all, where's the presumed competence? Second of all, where's the compassion? And third, if we want to take emotions out of it, where is the medical curiosity? Like, part of the reason I got into this sort of medical community is I'm a bit curious. I find this fascinating, right? Medical curiosity is going to really help us as we look at the body, and you don't need medical training to make a case for something medical, right? The other one I get all the time is a really tough one for parents. It's like, you know, I don't know if you guys took psychology, but they trained us in school, like, as you're leaving the office at the end of an appointment, that's often when people are going to tell you the thing that they were holding in the whole time, like doorknob confessions. And so one of them is the preoccupation with the private parts, right? Which is so hard for a lot of families from a social perspective. And again, Peter or whoever, you know, this is a pediatric statement, but if a child, a really young child is preoccupied and scratching and pulling and rubbing on their genitals all day, what they're told by their physician usually is it's masturbation. And then when we test for yeast, they've got fungal infections. They've got yeast infections of their private parts, which would drive any person crazy, right? So if you have yeast in the intestine, you can have yeast in your bits. And then with the food that we eat, that yeast is very itchy. Yeast, as you might know, here, it bores into the intestine like a screw. And when it moves around, it hurts and it's itchy. You can, your whole body, even your earlobes can itch if you have yeast overgrowth. All these cases come to mind when I talk about this, but I'll keep on track. And so the microbiome, the ecosystem in the gut creates a metabolism, and the metabolism is called a metabolome, and the metabolome governs our metabolism. So your gut's in charge. That's what this slide's all about. Yeah, there's genetic expression stuff. There's, think of even like, why do we see damaged intestines in people with autism? Well, they don't make enough energy to repair. So there's this energy for function, and then there's energy for repair. And repair in a world where we're surrounded by toxicity is a major, major problem. And once you have damage, you can't produce the same amount of vitamins. And again, it's just this vicious cycle that they're stuck in that you can help them get out of. So I get this all the time when we talk about diet. People with autism are picky. They're picky eaters. They don't want to eat anything. There's an element of picky eating. There's an element of mitochondrial support for swallowing. So like gagging, there's a sensory issue with texture. So they're in there. But most of the time they don't like eating. They're addicted to food. Like maybe all of us, I don't know, lots of us, carbohydrates are more addictive than cocaine. And I'm not saying that to be funny, although I do like to be funny, but they have studied using like functional MRIs. They've looked at people, I assume they had consent, and I assume it wasn't children, but they looked at people having cocaine and having carbohydrates. Carbohydrates are 8 times as addictive as cocaine. And so people say, well, they really like this. No, they don't. They're addicted. And there's only one way to treat addiction. It's cold turkey. And you're never going to convince a person who's addicted to carbohydrates to stop them. They may have intrinsic motivators, like my daughter recently, as she became a teenager. It was like a roller coaster ride. You know, she decided to take carbohydrates out because it was causing a problem with her skin. And she is young enough and has enough developmental control over her brain and body and the social interest of what she looks like. She has all those things to motivate her. But if you let anyone choose their diet, most of us would choose to eat this stuff 24/7. We don't for various reasons, but when you're working with a population that has differences in the brain, they're more likely to have addiction because of the architecture of their brain. They have less ability to control their body, and they hurt all the time. So part of this is self-medication. So in autism, they're already set up for this problem because they have these problems in the gut. So even animals do this, which is fascinating to me. We actually saw this in our cats, which is a weird thing, but we got 2 kittens, male and female, brother and sister. And we got them fixed because that's what you do. And I don't want 8,000 kittens. I don't live on a farm. So when they came back, the female cat, she changed. Her personality changed. And it was really stressful because we love cats, but we don't want like angry cats. I don't know what to do with this. So she was hissing and she was like mean to her brother. Anyway, she started eating bread. It was wild. She started eating stuff I've never seen a cat eat before. So I was like, maybe she's constipated. So I treated the cat for constipation, which I know is crazy, but by the end you'll be convinced I'm crazy. But her personality went back to normal. And so it's fascinating to me that what she was trying to do was shove more into her intestine to push what was in there out. And this is where you see this constant wanting to eat in so many people. Or you see the complete opposite where they won't put anything in. But most of it, they constantly want to eat. They constantly want to eat. They constantly want to drink because they're trying to solve this complicated energy problem where the whole intestine, which is supposed to be like a conveyor belt, at the grocery store, like moving, or an escalator, theirs is not moving. The stuff is sitting there and it is rotting. I had this case recently, and this young man, he's doing this thing called ruminating, which is a word I'm sure I learned when I was in school, but have long forgotten. He's taking stuff out of his mouth, food, all day long. And it was called a behavior. And even when they did sort of go in to get it treated, I think they tried to treat the yeast. That's a biomedical approach. But I went home and I said to my kids, like, okay, so you meet someone and they're picking rotting food out of their mouth all day long. What do you think? What's going on? And they're like, I don't know. Do they need enzymes? I'm like, amazing. What else is going on? Well, I guess it must just be sitting there. Yeah, it's like Occam's razor, right? Is that probably not the way you say it, but sometimes the simplest answer is the answer. And when rotting food is being picked out of someone's mouth all day long, it is probably that their whole intestines are full and the food is rotting in there. So just imagine what that person's going to feel like all day, right? Sometimes they shove shirts in their mouth. They try to get their fist in their mouth. They do all of these things that we would not do because we do not feel their pain, and we call it behavior. And I just think that's wacky. It's a very medical term, wacky. Let's see in here. I think we covered most of this. There's testing for this, actually. Some of the tests, like an organic acid test or a stool test, there's things that you can do to sort of test if there is a leaky gut. A leaky gut is when there's damage to the gut, and then you start to get stuff that's in the gut going out into the bloodstream. Maybe the easiest way to sort of think about this is that yeast makes aldehydes, which are indistinguishable from alcohol. And if you have an overgrowth of yeast, your brain is actually exposed to aldehydes all the time. So it's like if you had a martini on an empty stomach. Like, you want to know that your brain and your gut are connected, have a martini on an empty stomach. As long as you're over 18 and you're not driving. So we can test this, but these folks have things living in their gut, and because of the damage in the gut, they're creating aldehydes and even opiates. Clostridia creates opiates. So does strep. So these weird bugs in the gut, they are living things, and they make things that are, gliotoxins. They're brain toxins. They impact our brain. I'm only smiling because I have teenagers, so it's ironic. Some teenagers, they don't talk to you. Mine talk to me all day long. It's like it's a daily report. So this is a biofilm. The biofilm, so important to understand as it relates to what's happening in this sticky, gooey mess in the intestine. So this is a microscopic view, obviously, and the colored pieces here are a biofilm. A biofilm is like when maybe you were younger, or maybe you're in university and you didn't clean, your bathroom for a long time and you got slime. That slime is a biofilm. You go to maybe go for a hike and there's stagnant water and there's like slimy stuff. That's a biofilm. Bugs are social. When they find each other, they connect. They make a community called a biofilm, and it is polykingdom. So basically that means that the biofilm will consist of yeast and viruses and parasites and bacteria. So that's where, from a biomedical naturopathic perspective, functional medicine, whatever you want to call it, it's a holistic approach for an individual. That's what all those terms mean, right? So from that perspective, there's no point us just killing yeast or just killing strep or just killing Clostridia, because these bugs live in a nice little community here that's made of metals and minerals. So just imagine you're making a house out of metals, and then it's covered in sticky stuff. And it literally bores into the intestine and attaches to the intestine. And because it's sticky, two things happen. Poop sticks to it, and microbes are like, this is amazing. Like, we can just live in here and actually lower their metabolic rates. So it's like Club Med, that's how old I am. That's, it's like they're relaxed and they can go into stasis and just kind of chill. You can't kill them in a biofilm. They also quorum sense. Quorum sense is when they share information. So you go in and try to kill, streptococcus with, amoxicillin, you're going to get Clostridia being like, here's an email, here's a plasmid email. This is how you evade it, because three quarters of the genetics of a microbe is to evade being killed. And they've just now hit the jackpot with the metals in our environment, because now they can make communities within our body. And we know this happens like with hip replacements, right? Where you can get bacterial infections after hip replacement, because this is happening in the body. And the other thing I get you to do is sort of imagine an oil rig. If you put an oil rig out somewhere in the ocean, you're going to immediately have a community start attaching to the metal. And once you have stuff attached to the metal, then some little fish will come, then the big fish will come, then the bigger fish will come. So this, when it comes out, is sticky and gooey. It clogs toilets, it sticks to buttocks. It's sticky, and it's sticky for lots of reasons. One I mentioned earlier was the bile. They don't break down fat properly, which exacerbates this problem. But the ecosystem in here actually makes mucus, just like a sinus infection. If you've ever had a sinus infection, it's like you blow and so much comes out. You're like, how could this be in my sinuses? Well, first of all, your sinuses are this big. And second of all, the bugs in there are making mucus. So you blow and they make more, and you blow and they make more. And if you are an unfortunate person who has chronic sinus infections, you'll have snot stuck to the sinus wall, and sometimes it has to be surgically removed, right? So thinking back to that, having stool sucked off the intestinal wall in those cases that I discussed earlier. So the more metals you have, the more biofilm you have. The more bugs you have, the more biofilm you have. And I think this is what's happening, causing the majority of behavior. And it's treated with laxatives. And how many of the people that you work with are on laxatives, right? Like, they're all on Restoralac, they're all on, I don't know, Senecot, they're all on Ducalex, and they come see me and I'm like, no, they need diarrhea for a month. They need diarrhea for 6 months. They need to flush 18 to 22 feet of intestine. And I don't know how to help people do that in a better way. I just know what's stuck in there. The enzymes really help. They're very safe. They're actually not ridiculously expensive. You can give people bile. Just a quick word on that, though, for people who are from a religious or cultural standpoint, the bile is derived from oxen. So there are people who don't want any supplements derived from an oxen or cow. Also, it's not halal. So that I always say, and I have just said that as a disclaimer. And some people say, well, medically, if you think it's required, then we can do it. And some people say, thank you for saying that, because that's not something that we feel comfortable with. So this is, like real estate, location, location, location. Why is this such a pervasive problem? And why am I so convinced that this is probably impacting many of the people that you're working with? Because this is where the bile is supposed to come out. The bile is supposed to come out of the liver into the small intestine. And when it doesn't, your problem starts here. And so then the likelihood is it's all throughout the intestine. So when we do the assessment, the X-ray is for the large intestine, right? The large intestine. We can't really get a good look in the small intestine unless they're actually doing an endoscopy. So this piece in here, we start with the X-ray, and I actually have 2 or 3 of these cases recently where I had a young man come in and we did the X-ray, and he was full here on the lower right side. So on your lower right side by your right hip, and on the left side where the rectum is, where the poop comes out. So he's full here and here. And, like I've made this whole thing with the parents, like, well, if this behavior is happening, then we could hopefully help. If this is the reason, it's important to investigate. So I've made this case, and it's like, the X-ray did not come back full. And so I said, like, Your worst case scenario here is you're removing stool that could contribute to things like colon cancer. You're flushing the gut, it is safe. The intestines are rubber, right? You can't hurt them by inducing diarrhea with a laxative because we're using an osmotic laxative. So an osmotic laxative, as you may know, but again, just as for context, it brings water into the intestine. So that's like your Miralax, your Peg Flakes, your Restore-Lax. They're osmotic laxatives. They bring water in, they soften the stool. There's stimulating laxatives that squeeze the bowel. Those ones people say, oh, you can become dependent on. Ship has sailed. That ship has sailed. These intestines are never going to function properly if someone is like 25, 30, 40. If their biggest concern about giving laxatives is that they're going to become dependent on it, yes, 100%. Your bowel will probably never heal. That stinks, but getting the bowel the support it needs is like wearing glasses or getting the cane or something that some people need, hearing aids, right? Like you need this organ to have enough help to function. Because if you don't dump this out, it'll stick. And because the gut-brain connection, you're going to have the brain feeling awful. And we don't even know for most people because they can't tell us, but the behavior shows us. And I'm going to pull up one of the most important papers that I've ever read in just a minute. Or maybe now. Yeah, that ship has sailed. The laxative ship has sailed. They not only need laxatives, they need probably quadruple what they're getting. And so this boy, okay, yeah, no, I'm not quite done. So this boy was full on the lower right side, the lower left side, young man. And so I said to them, like, you have nothing to lose. So they did, I don't know, maybe 2 weeks of diarrhea, maybe 3 weeks. But they called me like 3 or 4 days later, called the staff, and they're like, he's just peeing everywhere. Like he's peeing everywhere. Like he's gagging and he's peeing. And so now I'm like, no, I was right. This is the bowel. And now the bowel is pressing on the bladder. And the movement and everything is like making him sick. So then we got another x-ray because he is older, right? So we got another x-ray and then it was full. And the parents were like, well, now he's constipated. And I'm like, well, I wasn't supplementing poop. So like, there's no way I could have constipated him. I didn't laugh, but it had emptied, the small intestine emptied into the large intestine. And that case was really fascinating because this sort of series of papers that I'll show you now, these are by Dr. Tim Bowie, and Dr. Tim Bowie is a pediatric gastroenterologist. He's at Boston Children's Hospital. He is at Harvard. He is working with the NIH to train medical professionals on the gastrointestinal problems in autism. And so he has his publications here, and these are gold. These are gold for your advocacy, trying to get the x-ray. And what I recommend is actually that you print out one or all of these. But from a mitochondrial perspective, check out where they've actually found, from an energy perspective in the intestine, where they have found that the autistic intestine slows down. So remember that picture I just showed you, the large intestine. So this is the lower right side. This is where they slow down. They don't make enough energy. And then because this part has to fight gravity, I suspect that plays a role. Also, our appendix apparently isn't for nothing, right? Go science. That's to help support the ecosystem in the gut, right? Like, I don't know if you've ever seen, what is it? There's like this space documentary on that big telescope, and there's somewhere in space, and it's like literally birthing universes. It's wild. That's what I always think of as like this little ecosystem in here. The appendix is putting out good bacteria to keep our ecosystem in the gut functioning. And so I don't know what's slowing down in here, but this is going to lead to a slowdown in the small intestine, because remember back here through those turquoise colors, that backs in. So the small intestine comes through all the little coils. It's both narrow and coiled, like a really scary roller coaster. And then it empties into the ascending colon on the right side. So they're going to get super clogged here. Guess where your big poops are coming from? They're coming because this system is tissue, so it stretches. And when it stretches, the poops that form here are actually larger. And by the time they make their way out of the body into the toilet, they clog the toilets. So that's something you should say when you're looking for x-rays. But there's also a fantastic list in here that Dr. Tim Bowie and his team put together. And they put this together, I think in 2010. I'm not sure there's a day that goes by that I don't look at this paper, actually, which makes me laugh because I'm sure Tim Bowie couldn't pick me out of a lineup. But I actually had a consult out of the US with the family, and they're like, "Oh, we're going to see Tim Bowie next week." And I was like, "Oh my gosh, can you tell him I love him?" And they were like, well, we'll see how the meeting goes. But I know it's pediatrics, but first of all, it applies to all applies to adults. Second of all, it applies to kids and adults without diagnoses. This paper has been transformative for me in my practice. So here's Tim Bowie. I recommend that you print this paper out. You highlight Tim Bowie, then you highlight his credentials. You can even get his biography off that other website, which is so fancy. Why are we doing this? Because we want to keep these conversations productive, right? The naturopathic doctors and the medical doctors, we don't always have the same opinion. Sometimes we're not huge fans of each, like each other's profession. That has no benefit for your patients and clients. So I keep that out of the conversation. This is just medical research. This is the best medical research on the planet. And I get you to kind of take a look at table 2, and we'll go through these, but I wanted to give you a minute just to read them, and I'll grab a drink of water here. But look at this list of behaviors that may be markers of gut pain or abdominal pain or discomfort in people with autism. Is any of this happening that you guys are seeing right in front of you as a frontline workers, right? In the heart of trying to support these folks? What if when these popped up when they were 3, they got treated? That's kind of my hope. That's my hope in having the opportunity to chat with folks like you, is let's help everyone we can, but let's also start helping right away. All right, so this is wild because this actually relates to Tourette syndrome. For a long time, I did a terrible job actually helping kids with tics and Tourette's. I just made them worse. My staff actually begged me. They're like, please stop. Just, it's not your thing. You're good at other things. Just stop. And then this paper came out and I was like, oh my goodness, this is what's going on. And now I'm actually quite good at it because all I do is flush the bowel. And that's why they call me Dr. Plumber. During the pandemic, I was home like so many people. I was lucky to be able to work from home. And so my kids would hear me talking, but they couldn't hear my patients. So one day my daughter looked at me and she's like, it's so funny. Like, I always thought you were this big deal. Everyone talks about how great you are. And she's like, all you do is give children diarrhea. This is so disappointing. And I said to her, the gut is the miracle drug. What I'm helping is get the junk out of the gut so that the gut can do the job that I could never do. I cannot do all those wonderful things the gut can do, but what I can help with is helping people get the junk and the garbage and the sand and the gooey, sticky stuff, the hard stool out. And just to kind of circle back a little bit, if you don't absorb poop properly, or if you don't absorb fat properly, the stool you're making is hard. It's like making a smoothie without oil, or a milkshake without oil. It's like, that's why the stool is hard, because the fat deficiency leads to old, sticky, gooey, hard stool. And then as it moves around the intestine, it hurts. And that's where I think you're getting many of the behaviors. This often blows people's mind, like when they see this and they're like, this is about my child. And I'm like, yes, this is this man's, from the best I can glean, that this is his life's work. And, this tapping one too is so fascinating. Years ago, and this kid came in and he just tapped everywhere, tapped on everyone, tapped on himself, tapped everywhere. And trusting Tim Bowie, I said, well, I think it might be to do with his gut. And as we treated the gut, the tapping got better. That's a wild one. They must have just picked that up by really, really good research. But this is probably the one I think that makes the biggest impact for you folks, these ones down here. I don't know, but that's the work that Peter and Adriana and all the other wonderful people part of the Community Living Project were able to kind of improve, right? The aggression piece, the self-injury piece, because it was in many, many, if not all those cases that I was involved in, this was coming in large part because of the gut. And so this is kind of like having a migraine, right? So if you have a gut pain, it's like if you had a migraine and someone's constantly asking you to do something, or you have a migraine and someone changes your schedule, or you have a migraine and you're supposed to go to therapy or supposed to go to school, or you have a migraine and there's fluorescent lights, right? Or you feel nauseous and someone's feeding you food that is making the nausea worse, but it's medical. This is a medical problem and it gets missed all the time. They do some really strange stuff, like, and I get it because they're in pain, but this screaming, I'm not going to do it as loud as I've heard and you've probably heard, but it's this like that kind of that is the gut, like almost all the time, or variations of that, like that. I've had people, you can hear them in the parking lot. I'm sure that if you're working on the front lines, you know exactly what I'm talking about. You know, this whole sleep thing where they don't sleep, or they wake up crying, they wake up screaming, they wake up banging their head on the, our digestive system works while we're sleeping, right? So when you're fast asleep and you wake up because your intestines hurt, then you're going to be pretty upset. They grind their teeth sometimes to the point where it's a dental issue. They just constantly want to eat, right? I know lots of people have had to lock the fridges. They not only mouth, I've had people who chew through like multiple shirts throughout the day. This one's an interesting one because it doesn't always come up as a straight up, like, I'll ask this question, they're like, oh no, they don't do that. And then you ask more about how they spend their day. I'll often ask, like, tell me what this person does all day long, like from the time they wake up to the time they go to sleep. And, you know, they'll be like, well, they sit in fetal position. Well, fetal position puts pressure on your own stomach. Or they love this ball. They love to bounce on the ball. Well, that's kind of like jumping. That's like jumping on a ball. Or sometimes they jump all day long. They're literally trying to dislodge the stool. And parents will say, oh, they love jumping. They love jumping and they love bread and they love sugar and they love juice. Like, love should not be applied to those things, right? Those are symptoms of something that's going on. The jumping, the flapping, it can be any repetitive behavior. Sometimes it is the repetitive stimming in front of the eyes, which, like I said, we'll get into. What else do they press their belly, or they hit their chest, or they hit their belly. Sometimes it's so aggressive and they bruise. Oh Lord. Non-compliance is a really interesting one because you'll see it in ADHD. So you'll see these kids with ADHD who don't focus well or whatever, and they're on meds or off meds. But the non-compliance with demands, or the ODD, oppositional defiant, doesn't get better because it's the gut. Straight up ODD to oppositional defiant is almost always the gut. Keep in mind the gut makes serotonin. Serotonin, if it's low and you ask me to do something, so you ask me to do something and I have low serotonin, what is the easiest way to manage that request? No. That ODD is a fascinating thing to me because it's so hard. And my oldest has ADHD and he's got a fair amount of ODD. And it's wild because it's just, sometimes my little guy will be like, you like argue what color the sky is. I'm like, I know. But this ebbs and flows and fluctuates with his diet and his bowel. And so I do feel very fortunate to be able to look through a lens of a medical lens rather than want to tear my hair out, because sometimes the defiance or non-compliance stuff is so awful, so frustrating. But I think it is very medical and it's quite treatable. If you improve someone's serotonin by clearing out their gut and giving them things to help make serotonin, which we'll also touch on today when we talk about methylation, this is very treatable. So just imagine if someone came in, or someone has all these issues, and you can say to them, there's a shot we're going to be able to improve a lot of these and maybe even get rid of some. Maybe if we're lucky, we can even get rid of all of them. And it's going to take probably 3 to 5 years to clean out the intestines of an adult. It takes about a year to a year and a half for a child. I would love if you guys have questions about this paper, because this is like, I'm going to meet Tim Bowie one day and I'm going to be like, oh, this is wild. Any questions, or should we move on? I guess I could look in the chat. Yeah. Oh, I think it's logging on. Okay, so Tim Bowie, not to be, you know, out of date at all, has just released another wonderful paper with his team. And this paper you can also find on his website. And the reason I share the website is because I think it's important that he gets credit, but also it's hard to find some of these papers. So if if you're having trouble finding them, I know when I Google the paper I just showed you, it's hard to find it. And then you can't really get the tables and it's harder to kind of print it off. But maybe I'm just old, but I think like when people come in and they show me something that's highlighted, I'm like, I'm going to listen to this. But if you like show me on your phone, I'm always like, I don't know. I don't like it, because I do have families, they're younger because my kids are older. And I'm like, did you show it to your doctor? Like, did you show them the paper? Yeah, I showed them. And it's like, just print it out. These, like, I don't know if the new doctors maybe show them on an iPad that's bigger, but they need to like visually experience the power of this paper. Let's see here. This is a pretty interesting one. It's only a case analysis, but I would say anecdotally, and with the research of Dr. Derek McFabe, which I'll definitely dive into, is this carbohydrate. People with autism cannot metabolize carbohydrates. It's not your fault. It's not their fault. It's not their family's fault. But it is just a sticky, gooey mess in there. They can't break down the fat. They can't break down the carbohydrates, and everything just sticks there and drives them crazy. So I know his second paper is in here, but I'm not really great at looking for it. So I'm just going to pull it up from my documents. So the other paper is more helpful in some ways, like the rumination I was talking about, that like picking the food out of their mouth. That was easier to kind of represent in this second paper. So when I think of the second paper, and I do typically send them both, but keep in mind, for me anyway, the doctors are super busy. They have a huge job. They've never been busier since the pandemic. They've been through a tremendous amount of stress, as all of us have. So we want to make it easy for them to help people. And so if they want to read the paper, love it. But if not, just kind of get them into this section where you see these symptoms listed. And so this paper I talk about more as it relates to problem behaviors around feeding or meal times, right? So you can sort of see like crying or screaming, aggressive in meal times, display self-interest behavior during meal times, right? So disruptive during meal times, biting themselves, putting their fist in their mouth, as I mentioned. And, these are great. Nausea, vomiting, dry heat. Some of these, they just gag, right? And they're gagging and we're like, well, it's a behavior, but I mean, we need to see past these diagnoses and say, well, why would someone be doing these things? We see this a lot, right? Like this food refusal, like they're turning their actual body and face away from food. This one, they spit out the food or they just pocket it, right? They'll be like, they have the pocketing behavior. Well, there's something else going on with their body if they have all these problem behaviors in around food. Sometimes there's overt digestive issues, right? Like if someone's having, I'll show you the Bristol stool chart in a second, but this, moaning, groaning, they do this. Peter taught me this, actually. They hit their jaw, because I didn't know that. But this constant hitting at the jaw, that definitely leads back to the bowel. Grinding teeth, gritting. Sometimes they'll say they're in pain, and we still, because we've been conditioned to think it's behavior, don't really register that, right? Or we'll say, well, how can they be in pain and then hit their head on the wall? Again, whatever self-interest behavior they're doing, I think they're doing it because they're already in that much pain and they're trying to relieve it. So those two papers you'll have. I'm going to create a resource package for you with all this stuff, so don't worry about not having it. And then, of course, you can access it through Tim Bui's website as well. So let's take a look at normal poops, just so we know what normal is. Bristol stool chart I have in my office. I send to all my families. When I ask them to fill in intake forms, I ask them to give me what does the poop look like? And I want them to tell me what it looks like, how many times people are having a bowel movement, what the bowel movements smell like, is there any blood or undigested food in the stool? The stool tells us part of the story, but keep in mind, it doesn't tell us what is stuck in there. Let's see. Of course, I picked the one that's not going to come up. And I think lots of people use these Bristol stool charts to talk about the stool that they're seeing. But when we're looking for bowel x-rays, okay, bear with me, I just need to focus. I wonder where my kids get it. There we go. I'm accepting cookies. I shouldn't accept them. I don't even know what I'm accepting. But this is painful. This hurts. When we look at the anatomy, the intestine, those pockets that we see, the pouches, that's because the stool has been sitting in there so long, it's pressing against the pocket, developing a ball. So actually people will start laxatives and they'll be like, well, now they're constipated. The balls were in there. I didn't make the balls. The balls were in there. Only the intestine can make the balls. And the intestines, sometimes they're, particularly on the right side, for two reasons. There's the big pocket down there, and then there's the fighting gravity. And so the stool will sit there, and because the tissue stretches like a sports sock, it gets into that bigger pocket, and that big ball is hard to get out. And so that's where the enzymes are important, because they break up the old stool, just like enzymes, if you take them with food, will help you with the food you're eating. If you take them away from food, they'll break up this old stool. I had a kid recently, actually, it was stuck in the rectum, like a big mass in the rectum. And they marked it an emergency at the hospital. And so we did all kinds of stuff to get that softened so he could get it out. And the parents reported it was like rotting sludge once it came out. And of course, the child's better. And that's a neurotypical child, which I don't usually treat. But again, the food supply is creating this pervasive constipation. So you can see the little balls starting to form. This will be hard and dry. This is more normal. This is the most normal. It's like a hot dog or a sausage, easy to pass. These are like soft lumps. This is never normal. It might be normal if you're like the person you're working with is on laxatives, but in people who present to me, like if they don't have a formed bowel movement after the age of 2, that's a problem. And sometimes it's like straight up water. That's not normal. The stool is moving around what's stuck in there. And then if you're having accidents during the day, that's why there's masses of stool, and then the new poop is making its way around. But the digestive tract functions on a log system, right? Like a log ride, maybe, right? They're logs. The logs have to move through. It doesn't function well on mushy stuff. So mushy stuff plus gravity leads to an inevitable clogging. And that clogging often happens in the rectum. And so because it happens in the rectum has so many nerves that you actually get a lot of behaviors once it's in the rectum. The anatomy, again, combined with gravity, this part's going to sink down. It's called the rectal vault. And a lot of times they're clogged here. So see this big pocket I'm talking about here? That creates a big ball. It's very hard to pass. That ball is bigger than that exit. So it's great if you can do enemas. We have parents that do enemas daily, up to 4 times a day. They work beautifully, but not always possible, obviously, right? I wanted to kind of circle back to one thing I mentioned just before I move on, is urinary accidents. Urinary accidents are almost always, so bladder. Speaking of cookies, I had to clean out, your computer's like, I've run out of space and you can't possibly save anything else on here. So I was like, oh man, I need to clear a bunch of stuff out. So it's like, well, do you want to clear your browser history? And I was like, not really, because then I can't search stuff so soon. So that's what you guys are experiencing with me today. So this is gold. This is, I think he's a pediatric urologist, but he's a urologist. And his whole website is about bedwetting and accidents. And the #1 cause of urinary accidents by far is the bowel. And they can tell you this at sick kids. They can tell you this, if you're a urologist, but keep in mind, this picture is the stool being stuck kind of in that rectal vault on the left side, just before the rectum, and it accumulates and it presses on the bladder, but it also presses on the nerves. So a lot of times I'll have kids come in and their main issue is they pee all day long. They have accidents. Sometimes they call behavior, right? Like, well, they get mad and they pee. It's like that. Why would we just assume someone having a urinary accident is the behavior, right? Again, presumed competence from a medical standpoint. Medically presumed competence. I'm totally gonna tag that. But he's got lots of free resources. There's Q&As, and in here you can see that they're recommending daily enemas, which have worked wonderfully. That's another thing to add to the list, though. If people do have these urinary symptoms, you add that to the list for the doctor to consider the x-ray. And the reason I like the x-ray is location. If you do, I've had now kids, it's like stuck under the right liver. So at that corner here, the splenic flexure, I've had lots of kids where it's here, it's severe, it's in the rectum, it's throughout. They've got gastric content, so it's right up to the stomach. Gas in the chest, which I had recently. That was my urgent one. I wanted to get Dr. Wendy Edwards to get this kid help because it must be excruciating. It's great to get the x-rays, especially if you get a medical radiologist who's really detailed. And that's wonderful. And again, that's like the team approach to trying to help these folks. I think I touched on most of this. I didn't touch on the opiates from food, which is an important one to remind myself of, is that you can do these urine tests. They're kind of wild, but some people, particularly people with autism, you see it in pandas, you can see it in like schizophrenia, severe OCD cases. They eat something like cheese or milk and they make opiates. It's called casomorphin because milk has casein, which is one of the 100 whatever proteins in it. Casomorphin is like morphine. So people are like, well, all they drink is milk and all they eat is cheese. Yes, they are addicted to it. It is a drug for them. And Yale did some work on food addiction too, and they also showed that dairy. I think the headline was like, cheese is addictive as crack. I was like, okay, but it is apparently. So, and gliadomorphin. So when they eat gluten, they actually make morphine out of it. So this food addiction and this biological change within the body is a very real thing. So I'm going to see if we talk about Dr. McFabe. This is Dr. Derek McFabe, and he is a neurologist. He has researched something called Clostridia, the bacteria, for 25 years, and his work is amazing. So what does it tell us? Dr. McFabe had a theory that antibiotic overuse was leading to Clostridia overgrowth, which is a bacteria, and it lives in all of our intestines, but in autism, they found there's many more members of the Clostridia family. You probably are most familiar with C. diff. That's one of the members of that family. So Dr. McFabe said, well, what if people with autism have more Clostridia? What does that look like? What does that mean? And he discovered that Clostridia creates a molecule called propionic acid. So we call it PPA. So Clostridia makes PPA. And so when he put PPA into the animals' brains, he used rodents, they changed. So within 20 minutes, they started doing repetitive behaviors in their cage. And then it wore off and they went back to normal. Then in some animals, he kept it in longer and they kept doing repetitive things, but they also started to change their social interaction. I learned that rodents sniff each other's bums as their way to socially interact. So they didn't do that as much anymore, which for them was not social. They also then started to become fixated on something in the cage, not the same thing for every rodent. And when Dr. McFabe sacrificed some of these animals, what he found was exactly what they found at Johns Hopkins, was that the brain had become inflamed. The brain had low fat, the brain had low B12, and the brain had other changes. Johns Hopkins had actually been studying human brains from people who had passed away with autism, including children, but they had donated their brains to Johns Hopkins, and Johns Hopkins found lifelong brain inflammation in the autistic brain. So I always say, like, if you have a person with asthma and they can't breathe, so they can't run or they can't play sports or they have trouble focusing or they get sick more often because they have low oxygen, that is a medical issue. Inflammation is medical and inflammation has to be treatable. And the longer you have inflammation for, the more damage you have. Like if you had inflammation in your knee that was not treated, eventually you may lead to have damaged cartilage or you may have permanent damage. This is really important. And I'll show you the Johns Hopkins paper, but I'll try and stay on one PowerPoint for a little bit. I should have taken a natural, like I do have natural stimulant stuff that I take because I'm a little bit ADHD, as I'm not sure you've noticed, but I worked with a psychiatrist once and he was like, does she know she has ADHD? And of course my staff just laughed and laughed because when you don't have great executive functioning, your staff becomes your lifeline. But the propionic acid stuff was mind-blowing because he was able, through this one thing, propionic acid, able to show what could be causing all these problems in the brain. But the biggest thing about his research, I think, was poorly understood. Propionic acid is in our food supply. Propionic acid is what we put in grains to stop them from becoming moldy. It's what we put in processed foods or like fast foods to stop them from becoming moldy. You know, like if you take what's that crazy donut place? You know, there's like, I remember there's where you take this type of refined carbohydrate and you put it on your desk and it's there forever. Like food is not supposed to last forever in that form. And it does that in large part because propionic acid keeps it that way. So of course we can't have moldy grains because that leads to mold-based diseases that also cause problems in the brain. But this is completely unregulated and it's global. So it is in the food supply. It is in rice and bread and cookies and crackers and cereal. and processed foods and lots of dairy, because dairy will become moldy. And the most incredible thing about Dr. McFave's research is he figured it out from Clostridia. He figured out that the food supply was contributing to it. He figured out that propionic acid slows motility, so that escalator, the conveyor, like the gut motility is impaired. He showed that propionic acid led to intracellular, so inside the cell, brain B12 deficiency. He showed that propionic acid depletes carnitine. So carnitine, for you folks who may not know, shuttles fats into the cell. So he said to me, Sonya, you know, autism is to fats what diabetes is to sugar. Like, these folks just can't get enough fat, they can't absorb it, they can't convert it, they can't shuttle it. And we run on fat, right? White fat runs our body. The brain is 2.5 pounds of white fat. Fat is like currency. Fat turns into ATP with the mitochondrial, you know, machinations. Propionic acid is a major answer. So he said to me not too long ago, he's like, Sonya, they asked me to figure out what was causing autism and how to treat it. And he's like, I feel like I went a really far way doing that, and like nobody's listening. And it's rough, right? That's rough. But what do? It's in the food supply. What we can do on a person-to-person scale is we can get this information out. We can start taking this stuff out of the diet of people who it is essentially a poison for. I would argue it's probably the leading cause of dementia and Alzheimer's. Alzheimer's, as you may know, they call type 3 diabetes, but this is the story of propionic acid. And the last piece is he was awarded a top 50 scientific findings in Canadian history one year. He then spoke at the Nobel Laureate Conference on this in 2015. He works with Scandinavians, Saudi Arabia, and all kinds of people around the world. We're still not doing anything about it, but he's fighting the good fight. When Dr. McFave removed the carbohydrates from the diets of these animals, their brains went back to normal. And it's not going to happen for adults who've had this forever, that I know that. But we do see this happening more and more the younger we're starting. And this has nothing to do with not accepting autism. That's criticism that I get. You saw I have Treat Autism as my educational website, and it's you know, people say, you're not accepting autism, you're not supporting or promoting neurodiversity. But for me, true acceptance or true understanding of neurodiversity is the fact that people with autism have medical issues and they deserve treatment. Like, we don't just accept migraine sufferers. We're like, oh, she just has migraines. Does she need treatment? Nope, we need to accept her. That really is very frustrating. As a parent, I get frustrated. As a practitioner, as a healthcare provider, I get frustrated. We see our school system does not have the funding to support our kids. We see, you know, in group homes, you don't have the information that could be helpful on a daily basis, both for the quality of life of the people you're working with and for the quality of life of the people working there. The cost in the healthcare system. I mean, it's just this one thing. I look sometimes at this PPA and I think, what would happen if we actually listened to Dr. McFave? What would happen if we regulated this? And it's not even about pulling it out. It's about regulating it. And so this may sort of be transformative for many of the people you're working with. There's some good research on diet. Like, people say, well, there's no research on diet. It doesn't show, you know, we don't know that diet works. I don't think that's true anymore. I mean, Dr. McFave's research was turned into, you know, people use his research for many books like Grain Brain, David Perlmutter, Martha Herbert, The Autism Revolution. There's a lot of people talking about paleo, modified ketogenic. Again, if you go back to like, how did we get this planet? Higher power, Big Bang, aliens, evolution. We were given meat, vegetables, fruit, nuts, seeds, and eggs. And now what we eat is cereal for breakfast, bread for lunch, pasta for dinner. We were never designed to metabolize this level of carbohydrates, let alone with propionic acid in it, let alone in an ecosystem in the gut that's been bombarded by antibiotics and toxins for, you know, the better part of 70 or 90 years, whatever it is. So when we look at treating autism, I do think it begins with the gut, it begins with diet. And this is the diet that I love. This is the diet that I recommend. I always laugh because my husband named our children, and so now I just name everything else, like my protocols, my diet. They all have a name because I missed out on that part. But I like the names. It wasn't like I was going to throw them out just because it was his idea. I'm not that ODD, but So yeah, no grains, no dairy, no white, yellow, red potatoes, anything that's sticky sticks. Limiting sugar, 1 teaspoon of sugar, as you may have heard, if you've ever sort of worked with a naturopath, 1 teaspoon of sugar causes immune dysregulation for 5 hours. So this is 85% immune system. So 2 pieces of bread has 6 teaspoons of sugar. That's 30 hours of brain changes. Vegetable, I did a series with a doctor in New Delhi, we're finishing next week actually. And so it was interesting because there's quite a few vegetarians on the call. And I had said, like, if you can consider meat a medical food with absolute respect for people's religious, cultural, philosophical sort of feelings around meat, it's a lot easier to make energy from meat than it is from lentils or beans. And they didn't love that. They did not love that. That created a bit of a stir in the chat. And so then I said, like, listen, that just straight up, it's easier to make energy. And I have lots of people who are vegan, vegetarian, and they can still get better, but it's just something to consider. But then I said, like, the other thing was we need to have real conversations, is that a child who is just eating rice all day long or bread all day long is not a vegetarian, right? They are a carbohydrate addict. So if you are a vegetarian, the literature supports that is a very healthy diet, but it is 50% vegetables. So we need to be really honest and upfront and clear about dietary intervention, because it really can transform people's quality of life. So there's, like, we get questions about fish. We like wild fish that is not farmed. Farmed fish self-cannibalize. So when one of your friends dies in a fish pond, you eat that friend, and so you bioaccumulate pesticides and PCBs and mercury. So we don't want farm fish ideally, we want wild fish. And if you don't have access or can't afford the wild salmon or rainbow trout, you can get white, wild, and small. And I actually find that some of the frozen fish is a pretty good price. We do like a paleo, we do like a pakora kind of, it's like a, like a almond flour breaded fish. My kids love, and then we do a paleo seafood chowder that they love. They absolutely love, because my parents grew up in the Maritimes, so that's a big one for them. And we want to try to get our kids foods that we grew up with, but at the same time, my children can't handle a normal North American diet, which I think lots and lots of people can't. So I think that might be a decent place to start, to stop. What do you think, Pete? Do you have anything to add to that? I'd love, just with your experience with all this.
Oh, Sonya, I can't add anything to it. You've just done an incredible job in this first hour and a bit to show us, what we have to do to take a much broader lens on what we're looking at. And I can attest to what you're saying because of your guidance, throughout our work. Most families, most adults in our sector who actually apply what we've given them a suggestion, make incredible gains. Our independent research, as you know, you're a part of 7 or 8 years ago now, showed that, just what we're able to do, we're dropping behaviors by 50-60% and increased folks' interest in life and just all the stuff that you hope for. And that was an independent study sponsored, by the way, by the Ontario government at $2.5 million. So even what we're doing, it's just integrating what you're doing and the great gifts you've given here. So I don't have any specific questions. I just think that you've set up the stage really nicely to show us why we have to really pay attention to what we're doing here. And then after break, let's talk about some more things that we can do. Okay, Adriana, Xavier, do you have any comments on that?
Sorry about that. No outside comments other than what you've just mentioned. And just like you said, Peter, with many of the folks that we've connected with, when we're able to really treat and heal this piece at the foundation of it all, we can see a cascading effect into just quality of life and improvements in so many different areas. So yeah, just this can't be understated as an area of importance to really check out with folks.
Totally agree. Yeah.
All right. When do you want me back?
Was 15 minutes okay for bio break and whatnot? About 10 to?
Perfect.
Does that work okay?
Yep.
Thanks. Dr. Sonya. That's excellent.
All right, folks, so enjoy the bio break. We'll see you soon.
All right, so we're back. Just sort of as a summary, helpful microbes thrive on a paleo diet, so meat, vegetables, fruit, nuts, seeds, and eggs, and harmful microbes thrive on carbohydrate-rich and sugar-rich diet. This diet reduces inflammation in the brain, and it can really help improve quality of life. So I have sort of another perspective to share, and I think, when I talk about my interventions, again, because I didn't name my kids, so I name my protocols here, but I call it the core four. The core four for me are the four most important treatments for people with autism. One is the diet, as we talked about. The other one would be clearing out the bowel. So I do connect those because they're about the bowel. The others center around the mitochondrial production of energy in different ways. So I'm not going to go through this in detail, but it is kind of interesting to read. When we look at motor planning is driven by mitochondria. Motor planning is impaired in autism right from the beginning, right from feeding, even into adulthood, sometimes with these issues, getting dressed, being clumsy, going up and down stairs. Articulation clarity is a mitochondrial issue. Like I said, all speech delay is mitochondrial. So this piece, what does this look like from a research perspective? Motor planning is often called dyspraxia throughout the world. In Canada, we call it childhood coordination disorder. And dyspraxia or motor planning impairment is part of the autism diagnosis. So most people don't have both diagnoses. But any fine or gross motor delay is dyspraxia. It is motor planning. It is, sometimes they call it apraxia if someone can't speak, but it all is to do with the mitochondria. So I use those terms and they're all the same. I use them and they all mean the same thing to me medically. So when you see this is something you can support. You can support this at any age. Certainly it's easier to see improvements as when we have the little ones, but you can see this improve at any age. So things like articulation, clarity, fine motor, feeding, independence, dressing, all this has to do with the way that we control our body through the motor plan that a reminder has to check with the sensory system. So if you have a sensory issue, you're probably going to have a motor planning issue. And this piece in here is particularly important to understand that the finest fine motor skills we have are eye contact and communication. So most times we think about fine motor, we think about this. Yes, this is a fine motor skill, but the finest fine motor skills we have are these. And so we see these as often, almost always, a problem in the world of autism. So in autism, we do see poor praxis, so the ability to create movement and motor plans. Praxis performance is a strong predictor of the features of autism, and it correlates with the social issues we see, the communication issues we see, and the behavior that we see. Dyspraxia, in my belief, they are right. It is a core feature of autism. Dyspraxia is something you can always improve. Lots of people with Down syndrome have dyspraxia as well. Cerebral palsy, like I said, global developmental delay. You can see dyspraxia in the ADHD population, and it's being missed and picked up as behavior or fine motor delays, or even focus delays that actually have more to do with the eyes and the visual motor planning. Dyspraxia is significantly more prevalent in adults with autism. Motor difficulties are significantly more common in this group, and these coordination skills are really important for social interaction. And I would add, obviously, daily life and independence, quality of life. The other piece is thinking about how hard it is for people that you're working with to even get what they're getting done, right? So they're fighting against this energy deficit where what they're doing is actually also taking maximum effort. So when you look at a behavioral component of that, if you were putting maximum effort out and still struggling, how frustrated would you be? How easy would it be for you to then have behaviors that came out of frustration, exhaustion, upsetness? And of course, when I'm exhausted, even as a I won't say neurotypical, but like as a pretty functioning adult, if I'm exhausted, I can be really noise sensitive, right? I can be sensitive to touch. I can be sensitive to too many teenagers in my house because apparently I'm running a community center, right? So imagine if you already have medically, diagnosed sensory issues, the maximum effort of fighting against this weak energy production, I think also contributes to problems in daily life. So this is the literature on it. I just thought that would be really fun to share. This has transformed my practice. This has really, really helped many people in my practice and for the people that I have been able to treat. So Meg Megson is a pediatrician in Virginia, and she came up with this medical hypothesis 23 years ago in this paper. She thought that this may actually have to do with the visual processing problems in autism. She thought that toxins could damage the retinoid receptors or the G proteins in the cell membrane, basically damage the cell membrane, and then cause problems with visual processing. And so years later, they've actually shown that if you supplement with vitamin A, well, first of all, they've shown that 80% of people with autism are deficient in vitamin A. They've also shown that if you supplement with vitamin A, there's significant improvement in autistic symptoms across the board. And vitamin A is a fat-soluble vitamin. As you may know, it is really, really important for visual processing. And so when you look at this making of a motor plan, this is the picture I promised I'd show you, see how close the motor areas and the sensory areas are in the brain. So that's why they have both motor issues and sensory issues. And the better medically treated they are with the sensory issues, the better the motor issues get. And then as you can see from the research in dyspraxia or praxis or motor planning or whatever we want to call it, that you see improved quality of life. So we know that 90% of people with autism have sensory issues. This is the root of many behaviors. I think maybe, Peter, it was you who told me this, but if not, you told me so many other things that I've never heard before. So I'll just say thank you for all of them. But the 90% of people with autism have sensory issues, but out of that, if they have noise sensitivity, that's the most likely cause of aggressive behavior. So if you have noise sensitivity, the noise literally hurts your brain. So I'll have, kids in my practice and the parents will say, yeah, they can't stand their little sibling, or the baby was born and they hate the baby and they want to hurt the baby, they hit the baby. It's awful, right? But what I say to them is that the baby is hurting them too, and the baby doesn't know that, but the baby crying is actually hurting their brain. And so if we understand how much pain and discomfort folks are in, I think it's easier to understand where some of these behaviors are coming from. And so how do we kind of treat this sensory integration? I think it's really critical to treat the visual processing issues first if they exist. And they exist in many sort of different ways. Okay, so spinning, side glancing, looking into the sides of the eyes, squinting, covering the eyes. What else? Lensing. They do this thing where they like a camera lens, like they're trying to go in and out. Just straight up lack of eye contact. They line things up, right? Or they find like little things off the floor and then they eat them. That's a set. All those are visual symptoms. Even lack of focus, right? In some of the people who are able to sit down and learn, but their eye contact or their visual endurance isn't there. All of that to me has to do a lot with what we see with these visual processing deficits. So there's a wonderful researcher, and he's got a great TED Talk that's listed above. He's a visual neuroscientist, and he has helped a lot. He's actually helped hundreds of children regain sight through his research in India. And he's the only person that I know, there may be others in the world, that has studied visual processing in children with autism. And, you know, if you don't want to watch the whole TED Talk, you could sort of say these are the parts he talks about this, but I stole his idea and did my own slide. But we're not born knowing how to see. We learn to see. And how we learn to see is by watching moving information, dynamic processing. So processing moving information is one of the most important things for the brain to move on, to group things, to integrate things, and then to get to the point where they can recognize things. So the first symptom of autism is actually visual processing deficits, right? When babies are nursing and they're not looking, they're not tracking. Visual tracking is one of the first, if not the first, signs of autism. And so you can see in here, the brain needs 40% of its energy in any given moment to be able to process the world. And we are not seen as an outward action, right? We are bringing the world in, our brain is processing, figuring it out, and then we are projecting what we are able to process or figure out. That's why some animals see in black and white, some animals can see heat signatures, right? Our brain processes the data. So this is really important because this is not happening very well in autism. So yes, then you will see someone spend their life lining things up, or they, like I said, they get these little strings and they look at them really, really closely. They stim in front of their eyes. They watch the same thing over and over on an iPad. They watch credits. They drop things in front of their eyes. They may stare out the window and watch the trees all day long. They are engaging in repetitive behaviors, I believe very strongly, in an effort to repair the retinoid receptors. For example, if I, say I got hit by a bus and hopefully someone would save my life, I go get surgery or whatever. After surgery, I would need some pretty heavy duty physiotherapy, right? So I would go see the physiotherapist and he or she would have me walk back and forth over and over, lift my legs over and over. Through repetitive therapy, I would be able to reconnect my brain and my body. So these repetitive behaviors that people are engaging in, to me, mean something, particularly the visual ones. This is very, very, just like the Tim Bowie paper, this is gold. If someone has these visual symptoms and we can repair their absorption of vitamin A, their absorption of fat, because vitamin A is a fat soluble vitamin, so you need enough fat to make it work. You also need to fix the bugs in the gut because the bugs in the gut deplete vitamin A. So there's that bug microbe connection. The more often you're sick, the more vitamin A becomes deficient. So think back to that first sort of Leo Kanner cases, the 1 to 11, where they had frequent infections, right? So they're going to have lower vitamin A. The sticky stuff in the gut is going to stop the absorption of vitamin A. And so 80% of people with autism are vitamin A deficient. And how many of them engage in these visual repetitive behaviors that we call stimming? Well, I would propose that it is actually quite treatable. It does take a long time in intestines that have been damaged, but once you fix this stuff, then you can see improvements in social interaction because they can actually process the world. When we're taking cases, they'll say they're just off in their own world. They don't make eye contact. They won't respond. They do the same thing over and over again. But think about what would happen if your vision went offline. I have a dear friend who's an optometrist. She's a developmental optometrist. So she does vision therapy for kids and adults who have these visual processing issues. And first of all, she sends her folks down here to get all kinds of fat treatment, like omega-3s and omega-6s and vitamin A, vitamin E for you naturopaths who are watching this, mixed tocopherols. And she says that improves their visual processing, their vision therapy. And our vision needs a lot of fat to functions. But she said to me years and years ago, maybe 15 years ago, she said, come up to my office. I want to show you these glasses because this is what people with autism are dealing with. And so I went up there and she handed me the glasses. She's like, just so you know, you're probably going to have a headache. You might feel like throwing up and you might be sick. Like you might actually be really unwell for the rest of the day or even tomorrow. So I put the glasses on and yeah, I've never felt so disoriented or uncomfortable. I did get a headache. I felt awful. And even the memory of it. So this is what folks are dealing with all day long when they're going down the stairs or when they're trying to get dressed. And so when we keep calling these things behaviors or delays, if you can't process the world you live in, you're going to have symptoms of that. And those symptoms often you can pick up. Squinting, yeah, side glancing, visual processing. I think that's a lot of them. And the screens help, right? Because the screens are stimulating. So one of the reasons I get addicted to screens is that it really helps this issue. Just like if you had a cane that would help you walk. Vitamin A is fat soluble, so it is theoretically toxic, but you have to go beyond a certain level. You just have to do the math. I do the math for every patient. You cannot exceed 4,000 international units per kilogram, which means that most adults can take a ton of vitamin A without any issue at all, right? You test liver function, liver's fine. You're going to have no safety with vitamin A. I've never had a vitamin A safety issue, and I have had the privilege of working with about 10,000 patients at this point because I'm getting old. So this is critical. If a person has visual processing symptoms, their brain is functioning at lower than 40%. So we need to pump that up through the energy production, the mitochondrial production of ATP, the vitamin A, and so that we can get people moving on through this process. The other really important thing that Dr. Juana Sinha, the neuroscientist, talks about is that if the visual processing is impaired, the rest of the brain slows down. So by fixing visual processing, you're actually going to see the brain speed up. I think this is really particularly important when we're seeing this happen in little people, but I think it's going to help everyone. So here is a homunculus. This is a visual representation of where the body allocates its energy. So when we make energy, the bigger parts of our body take more energy. So people who have mitochondrial impairment have predictable delays in the systems that require more energy: the eyes, the mouth, the tongue, and the hands. Have you guys ever seen like a tongue in a grocery store? You know, sometimes they sell the tongue and you're like, that thing is like this big, right? It takes so much energy to make the tongue work. And that can also cause feeding issues if you can't control your tongue, right? It will cause problems with textures because your tongue is not functioning properly. And that's just one little example of not enough energy and how it relates to one symptom that we see. The cell membrane, this is made by a process called methylation. Methylation is what I want to touch on next, because methylation is impaired in autism. I do have a lot of the research in here for those who are interested in the mitochondrial piece. You can go through the earlier part, but mitochondria make energy, and mitochondria love the paleo diet. They make energy better on a paleo diet. They make energy better when you have a high fat diet, healthy fats. Mitochondria loves exercise, mild to moderate exercise, movement, and all these herbs that we can get in our food. You know, these also improve mitochondrial production of ATP. But what is methylation? Methylation is how sperm and egg become a human. So after conception, those two cells, I don't know if it's a blastocyte, I can't remember, it's been a long time since those years, but that combination turns into a human baby through a process called methylation. Methylation governs the production of cells, neurons, myelin sheath that goes around neurons. You know, what happens in multiple sclerosis is that myelin sheath is being destroyed. That's a methylation issue. Methylation makes all our organs. Methylation governs, like it says, 200 pathways downstream. So Jill James at the Arkansas Children's Research Institute is a biochemist, and she figured out that 90% of people with autism have methylation impairments. She also figured out that their parents and grandparents had methylation issues. Methylation issues are also part of the genetic difference that happens with Down syndrome. So methylation is improved by methyl donors. My favorite methyl donor is methyl B12. Methyl B12 is injected into people with autism and other people with developmental delays or even neurodegenerative concerns like Alzheimer's, dementia, Parkinson's, because it improves 200 pathways in the body. So I love injections because it's 100% absorbed. Oral is only 5%. When they have looked at the brain tissue in autism, this was done by Richard Deeth, who's a neuropharmacologist. They found that children with autism who are 10 years old, their B12 in their brain was 3 times lower than neurotypical children. They had the B12 levels of about a 50-year-old. So you can't test B12 in the blood and get an idea of what's going on in the brain. The brain tissue has told us it's deficient. That's the best information we have to go on. And so we do recommend injections of B12 whenever possible, because it's going to drive this pathway. This is like a gear or a bicycle. These two wheels have to work together. So the pink wheel is the folate wheel. As you may know, we synthetically fortify our foods with folic acid. That's synthetic. You have to metabolize that and turn it into something called methylfolate. It's called methyl tetrahydrofolate. And that's gold for the brain. Methylfolate is gold for the brain. So is folinic acid. That's just some biochemistry stuff. But we have to make that. And if you don't make it, then your brain is lacking it. And then all these pathways are more tired, including the production of things that support detoxification of harmful toxicants, things that reduce inflammation, and things that produce brain chemistry like serotonin, dopamine. So this is really, really critical, and it slows down with our diet for a totally different reason than the propionic acid. But the propionic acid will also slow it because, as I mentioned, but it's important to kind of revisit, propionic acid leads to intracellular inside the cell B12 deficiency. So even without methylation impairments, which means these wheels don't work very well for people with autism, these enzymes are slower. So enzymes and genes are the same, right? Our genes are not static. You have a set of genes, you have about 35,000 genes, and they all have a job to do. They work. That's why genetic expression is a term. You can improve how well your genes are working by what you eat, your exercise, your mood, your mindfulness. All of these things improve the way your genes work. But in methylation, these enzymes don't work as well. So they cannot convert the crappy folic acid in our food supply into the gold for the brain. They need to remove it by removing the grains. They also need to help this wheel by adding in B12 and B2. B2 is riboflavin. That's what helps this enzyme work. So B12 injections, B complex, right? So now we've got paleo diet. You got flush the garbage out of the gut. We've got B12 injections and a B complex. That's not that hard, right? I shouldn't say it. It can be doable for many people because diet is hard. Midline here, this will slow with things like lead and mercury, stress, fungal metabolites. That's what's slowing the bicycle, like the brakes on the bicycle. So what we need to speed up the system is pretty straightforward. Remove the synthetic folic acid from the diet. You can even add folates, those green leafy vegetables. Like that's why we want half of our diet to be vegetables. They're methyl donors. Things like onions and leeks and beets, right? These are all methyl donors. This green wheel runs on B12. This green wheel also needs zinc, which is, I'm going to just very mini digress. But I think I'm going to mini digress because we might be seeing this as a challenge to our success with our patients and the people we're working with. This also needs zinc. So what happened with COVID, because COVID is pro-inflammatory, zinc is having a lot of trouble getting back in the cell after you have COVID. So the inflammation is trapping zinc outside of the cell, and it's supposed to be inside the cell. So we're actually having to solve this problem. This is what's leading, in my opinion, and many people's opinion, to long COVID symptoms. Without zinc, zinc is also part of 200 enzymatic reactions in the body. You get a lot of problems with the different organ systems. That has a lot to do with methylation, and there's a way that you can get zinc back in the cell by like a little bridge. The bridge is called quercetin. It's a zinc ionophore. So is green tea. So we're seeing as naturopaths a lot of post-COVID sequelae. And post-viral illnesses are not new. This is the massive amount of them at all sort of the same time. And I think they're way worse with COVID than influenza and some of the other viruses. So it is a bit of a digression, but not entirely, because the other thing that zinc does is support motility. So we're seeing people who this stuff was working for, then it's not working for, because the motility has been further, like it's been worsened by COVID. Interesting. So this pathway, so your folic acid comes in either through the grains or through green leafy vegetables. The folic acid is preferentially bound, so the body will bind the crappy stuff first. So you want to get rid of it, so it can only bind the good stuff. Then we help with the conversion. This methyl donor is then donated to 200 cycles in the body. And this relies on mitochondrial production of ATP. So you see how those are connected. Whenever you hear from me, praxis, motor planning, dyspraxia, mitochondria, the solution is fats. That's why I love paleo modified ketogenic. What's the difference? We add a ton of cod liver oil in. And why do we add cod liver oil? Because it contains vitamin A. So when you go back to cod liver oil being my favorite, it's because it contains the vitamin A that repairs the receptors here. It doesn't have to be cod liver oil, but I like cod liver oil. And you know, even I've started doing a little bit more geriatric care, which is just really interesting to me. It's been awesome. Improving the quality of life of seniors has been really, really exciting because they're great responders and they need a ton of fat, but fat runs our body, right? Whether it's our tendons or reducing inflammation for things like arthritis, 2.5 pounds of fat is our brain. So anything to do with the brain. And lots of seniors go through things like they have surgeries, and so then they need more fat after that. So mitochondria needs fat. They need to be able to get the fat through an intestine that works. That's why the gut is always sort of the starting point. But what I typically do is I ask people to consider going on a paleo diet, starting the B12 injections, getting the cod liver oil in. And again, we're just doing the math, right? If you're 20 kilos, you can take up to 80,000 units of vitamin A a day, right? If you're 50 kilos, then you can take more than that. I'm not gonna do the math. I think it's 100,000, but you know what I mean? I do the math with every patient. And we get this question all the time. It's a great question. The other thing I explain to people that because we either evolved or were given biochemistry by a higher power that works with vitamins, those vitamins can't kill us unless we want to torture someone. And I'll give you the vitamin A example, because people will say, oh, it could be toxic, I'm worried about it. Perfect. Give me all your questions, give me all your safety concerns. However, if I wanted to kill someone with vitamin A, I would have to torture them first. Because even before their liver would be harmed, they would vomit all day long. They wouldn't get off the couch or the floor. They would be so lethargic. They would get a weird alligator kind of rash. Their hair could fall out. This is before the liver is damaged. So you can't hurt people with vitamins the way you can hurt them with drugs, because we are designed to work with vitamins and minerals. All of these enzymes, they have what's called cofactors. Those are minerals and vitamins. Our biochemistry runs on what comes from our food. So when we put those in a higher form in a vitamin, it's demystifying the safety issue in there with supplements. If you take a medication, those were not created in the same way to work with the body, so they can jump over all our safety signals. Because vitamin A is critical to get people better, and sometimes there is pushback because there's the worry about the safety piece. I've never had anyone harm from vitamin A. Thank God I've never had anyone harm from any of my treatments, because natural stuff is very safe. The problem, I think, is dosing. We don't dose high enough, particularly in the pediatric population. So when we look at the methyl cycle, it's the backbone of our physiology. It determines whether you can actually get rid of toxins. So again, in the beginning of the autism research, when we were first sort of debunking that people had autism because their moms were neglectful, the refrigerator moms, during sort of that time frame, they started to say, okay, well, maybe it's toxicity. And I don't know if you know, but the RhoGAM shot, you know, when people have a blood incompatibility when they conceive, so then the mom has to take something to get the blood to be compatible so the baby doesn't, there's not a miscarriage. So this whole blood compatibility thing, the RhoGAM, that shot had mercury in it. So the researchers said, oh, we're going to prove this is mercury. So what they did is they went about and they collected hair from people who had ended up with autism and their moms had had the RhoGAM shot, and people whose kids had the RhoGAM shot during pregnancy, but they didn't end up with autism. And they're like, we're going to show these kids who ended up with autism have so much mercury in their hair. We're going to prove it's the mercury that's causing autism. And they found the exact opposite. They actually found that the people who ended up, the kids who ended up diagnosed with autism, their baby hair had very little mercury, even though they had mercury exposure during pregnancy. And the children who did not end up with an autism diagnosis, they had mercury in their hair because they could get rid of it. And so in a world surrounded by toxins, lead, mercury, fire retardants, phthalates, pesticides, I could go on and on. My sister does these lectures. Her background is biomedical toxicology. So she'll do like a 3-hour and everyone wants to just go home and cry because she just talks about all the toxins the whole time. So I let her do like an hour of doom and gloom. And then I'm like, let's give some good news. But the methylation cycle, if you improve it, you will improve the removal of these products through the production of glutathione. And glutathione is what they call the body's master antioxidant. And so, you know, we can help our genetics by taking the pressure off, for example, with the methylation, take the pressure off, take the folic acid out that's synthetic, add the B2, add the B12, maybe add the zinc, maybe add the quercetin post-COVID times, and let's get this methylation cycle performing better. Your body performs based on what your genes are capable of doing. And so unfortunately, people with autism, they start out with methylation impairments. The cool thing about methylation, though, is if you keep supporting it over years, you'll transform cellular function. And the body's cells turn over in 7 years. So as I've gotten older, I've become a big, big believer in long-term treatment. I think before, when people have asked me, well, how long do you have to do this? Well, first of all, you don't have to do it. I think you should try to do it. And if you can do it, try to do it for 18 to 24 months. But now, because I have kids now that I've worked with since they were little, now they're teenagers or now they're in their 20s. And the ones who've continued have continued to get better. And my son's in that category. And I just feel so blessed to have had that opportunity to keep going. Because mitochondrial production of ATP, improvement of methylation, all of this has a massive ripple effect on an organism if you keep doing it. And we are, you know, we're completely surrounded by toxins. That's a lot of toxins. Most of them have no research, unfortunately. The ones that are researched, often they are related and linked to autism. And this methylation connection to mitochondria, you can't disconnect them, right? So if you're going to improve one, you'll improve the other, but you're better to try to work on both because you'll have a lot more effect downstream. So let's see what else is interesting in here. This is really like, when we do testing on folks through something like an organic acid test, they almost always have abnormalities in their neurotransmitters or their brain chemicals. They often have extremely low serotonin, leading to noise sensitivity, problems with sleeping because serotonin makes melatonin, as you probably know. They have anxiety, they have noise sensitivity. I don't know if I said that, I think I did, but these are made by the methylation cycle. The methylation cycle also builds immunity. So we look back to that Leo Kanner paper, the chronic infections, right? I don't know if you see this, but we do. We see kids who are just constantly sick. And it's because their immune system also needs the help of methylation and mitochondrial production of ATP. Histones just protect your genetic material. I don't know if you know this, but our genes are like a double helix, and then they're like bound together really, really, really tightly with a globule of fat, which is a histone. And the reason why that's important is that if you don't have the protection of the genetics, then your genetics are being damaged all the time, and that leads to poor function in the body, but it also increases risks for chronic diseases. This one's huge, the cell membranes, because if you're making cell membranes, you're also responsible for repairing them. So our folks can't repair their cell membranes very well. And again, the vicious cycle. I have seen on a fair number of MRIs myelin problems. Like, and they'll say like, you know, myelin demyelination of unknown origin, and they don't know what it does. But I think we'll find in years to come there's a myelation problem in the brain. And that has an impact, obviously, on how the brain works, because myelin, as you may know, allows the nerves to send messages properly. If you don't have that myelin around the nerve, then the nerve does not function very well. So I think these are the three most, well, these are three sort of things to touch on with the methylation cycle. It's tough to say what's most important because they're all so important, but glutathione, as I mentioned, is the body's master antioxidant. It removes most of the toxins in the body, but it also regulates glutamate. When we think about the brain chemicals, glutamate is the most important brain chemical, but it's excitable. And this is why people with autism can memorize movies and books. And, you know, sometimes I have kids who can speak like 15 languages. They can do 4x4 math in their brain. They can do physics at 3. This is why this is happening. Glutamate is what creates the giftedness and the uniqueness in these brains, but it's got a cost, as we know, because glutamate is what causes that immunoexcitotoxicity. And so I kind of just show this picture because I think it's a nice visual. Remember that 85% of the immune system is 85% of the brain is immune system, and when it turns on, it gets excited. And there's actually there's a huge redundancy within the brain to manage glutamate, because if it gets too high, it causes all these problems. So we know oxidative stress is linked to autism, inflammation. The activation of the immune system is called microglial activation, and this toxicity can lead to damage. So it's got to be strictly managed. And what happens is this contributes to scripting, echolalia, repetitive behaviors, self-injurious behaviors. This makes the brain feel like it's on fire. You know, if you've ever talked to people with autism and their brain is racing all the time, it's racing. And I've had a young woman in here years ago, and I think she threw a computer, I think, at her teacher, something like that. And so I said to her, like, can you walk me through what was happening leading up to that? And she was talking really, really quickly, but she's like, it's so loud in there, and then the fluorescent lights, and I can hear everyone on their keyboard, and I can even hear people in the other rooms, and I can hear the lights buzzing. And the only thing that calms me is just like looking at the screen, and whether she was playing the game or doing work, I can't remember now, years ago, and she's like, and then he turned the computer on. And so she threw the computer at him. So she said, even now in the office, I can hear your staff, I can hear them typing, I can hear the people at the gym. Their brains are totally overloaded, and they're trying to manage this all the time. So the cool thing about the methylation cycle is that the methylation cycle actually helps this tremendously. There is aggravations, which I'll touch on in just a second, but let's say everything's going smoothly with the gut after we've worked on it. And you put B12 in, and you can start to see the glutamate come down in the brain. Because if you can improve the production of glutathione, you can improve the glutamate. And how does this happen? It actually happens because glutathione, here, I'll just show you the word, because I know it's sometimes all these words, you know, it's like glutamate, glutathione, and gluten. It's just like, but glutathione is the body's master antioxidant. The way it's made is made from glutamate. So when you put B12 into someone's, you know, regime, or you put B6, or you put N-acetylcysteine or zinc or anything that helps make glutathione, you're literally mopping up the extra glutamate, because glutathione will combine with 3 things, and one of them is glutamate. So if you provide this process support, you're actually mopping up excess glutamate in the brain, and you can see these repetitive behaviors, the stimming, the echolalia come down. So it's great, it's safe. B12 is water soluble, it's non-toxic. You don't really have to do the math on the B12, but there has been studies where it kind of shows what level would be the best to start with. And then once this research came out with Richard Deeth, here, I'll just pull it up here because it's an important one to see. Richard Deeth is a neuropharmacologist, and he actually showed that the B12, like I said, is 3 times lower in the brain in children diagnosed with autism. And so if you don't have enough brain, then over the years, what's going to happen is you're going to have more and more problems in the brain. So he showed this for aging, schizophrenia, and autism. But the interesting thing about his research is he actually made a point to say that it wasn't something they could test in the blood. So that study's not too long ago. Dick Deeth, just as we're talking about Richard Deeth, he also did this really cool study. Oh, I think it's going to start playing. So I was going to play this video, but not now. There we go. He also did a study on A1 versus A2 casein. We often get this question about dairy, like, do we really have to take out the dairy? Again, you don't have to take out anything, but if you look at what's happening when we eat dairy, first of all, dairy is pro-inflammatory. So every time you eat dairy, you're creating inflammation. And if you're a person with inflammation, you don't want to create more. But he actually showed that dairy, so things like yogurt and milk and cheese, every time you eat A1 beta casein, which is the dairy that we have access to, it actually reduces glutathione, and it impairs cognitive function, and it causes inflammation. So if you look at the Johns Hopkins research, right, when I talked about that, and you'll get all these resources, but when you looked at the Johns Hopkins inflammation, I'm so used to these coming up because I've been Googling them for years, but of course my old Mac is like, she's the fan starting, like, this is too much for me. But this shows lifelong brain inflammation. So this is medical, right? This is medical. And if it's medical, then parts of it are treatable. And the earlier you treat, the more of it's reversible. And so this is where it has nothing to do with curing autism or pretending autism isn't real. We're saying, no, like, people with autism have medical issues and they need medical treatment, just like people with Down syndrome. We know people with Down syndrome are more likely to have thyroid issues and metabolic issues and weight issues and Alzheimer's. So then they get tested and treated from a young age. And they actually do really, really well on a very, very similar approach. And at the Arkansas Children's Research Institute, they did B12 injections for kids, and they noticed a significant improvement in autism, and now they're studying Down syndrome. So methylation plays a really critical role, and part of that role, not all of it, but quite a bit of that has to do with the glutamate. The glutamate causes a lot of these problems. It depletes the glutathione, and with the glutathione depletion, it's about 80% of the glutathione is depleted in autism. Then you get a lot of different problems in the brain. You're also going to get learning problems, right? You're going to get language problems. So learning problems, like, I can memorize, but I can't deduce. I can memorize, but it's more difficult for me to break it down and tell you what I understood out of it. So the other problem is you're going to get language issues. You're going to get repetitive language. So I always say, like, if I was going, you know, like when I was working in China before the pandemic, I was like, oh, maybe I'll learn like a few phrases in Chinese. First of all, I could barely say hi in Mandarin. Like, even hi, they're like, that's hilarious. So my brain won't do that. But I thought if I could memorize a few things, I might be able to navigate. Glutamate leads to memorized language. It's not functional language. So when you see the scripting, or what I call functional scripting, where they're trying to have their needs met, but it's like a memorized statement, this is because the glutathione isn't high enough to facilitate more functional language. And so this is great. If people communicate verbally, this really, really helps. If they're nonverbal, a lot of people are moving towards letter boards. I'm not sure if you folks have seen the documentary, The Spellers. That's pretty cool. They're communicating off letter boards, and they're people from the non-speaking community, but they're advocating, and they're basically saying, you know, like Fox said, I can understand everything, but I can't make my mouth move. I can't control my body. And this group is really helping us understand more about this presumed competence piece. And I don't think I ended up reading this, but it might be a good time. So this boy is non-speaking. He communicates off a letter board, and this is what he says. Autistics are smart, however, our minds are not listened to by our bodies, not able to control my body, and it is quite frustrating. Not being in control is a hard and scary thing. I am also very impulsive. I can't stop myself from always grabbing anything I see, from going in kitchen, from always looking to know how something breaks apart. Mind understands how to hear and understand instructions, but not how to make body listen. I am knowing not right to do these things. I feel bad when I do them. However, I have no ability to control it. I am feeling a lot better now that I can explain myself. I am feeling people have more compassion for autistics like myself when body-mind disconnect is understood. Being autistic is very hard sometimes, but it is also amazing. Acknowledging, again, autism is not a tragedy, having no voices. So Fox and I think it was one or two other kids came for one of Peter Mark's sessions with educators, and this was in the Peel region, and their moms read their speeches. I don't remember if this was the one Fox was talking about in that session, but like the educators were all crying. They were all crying. And, you know, one of the boys said, you know, I'm not stupid, and you keep trying to teach me colors and numbers, and he can't control his mouth, and he can't point because that's motor planning. So we have a major disconnect in what we understand people are capable of if we're just judging it on their communication or their behavior. And so that's why I think medical treatment is so important. I do like what's happening out of the speller community, but I'll admit and share with you, I have frustration around this acceptance piece of not medically treating the lack of control in the body. Because the lack of control comes from this methylation problem, this mitochondrial problem. And so every minute living without control of your body is stressful, overwhelming, exhausting. And so at any age, if you can improve this, I think that it's really important to try. There's also, again, the overall health piece. Glutathione protects us from toxins that we are surrounded by. It helps to protect us from illnesses, right? So post-COVID, the glutathione is so low, you're getting these long COVID symptoms. That's a lot of part of the brain. Keep in mind that, you know, the brain needs glutathione to get rid of that glutamate. The lungs also need glutathione. The lower your glutathione, the worse your asthma. You can nebulize this, by the way, as a total aside, but this is huge. And N-acetylcysteine, actually, they studied at Stanford. That's a precursor. They studied it at Stanford, and they showed that there was a reduction in behaviors, stereotypical behaviors, and improvement in social interaction for children with autism. They were aged 3 to 8. That was an RCT, randomized control trial out of Stanford. So these are things that we have access to. They are safe. N-acetylcysteine, which is called NAC, I'll just throw this in here because I know just throwing around new words can be not always fun, but it's N-acetylcysteine is typically called NAC. And it gained popularity during the pandemic because it was helping a lot of people with their breathing. I can't spell. Can I spell? N-acetylcysteine. There we go. And so this actually makes glutathione. So they've actually studied it in women who are pregnant to help to prevent miscarriages. They've studied it in OCD, Prader-Willi, for those, you know, the Prader-Willi where they just want to eat all day long. That's a form of OCD. It helps with that. And again, it's really safe. You can take it as a supplement. You can nebulize it. But these are some of the things we're talking about that could transform people's lives. This is also mucolytic, so breaks up mucus. This is cool because you put it in the intestine, and sometimes people start pooping out mucus. We go back to the whole bowel piece. The mucus has got to come out, and when it comes out, it's really sticky and gooey or globs of mucus. I have teenagers and they're like, Dr. Sonya, when am I going to stop pooping out mucus? And I'm like, that's good. That's blocking you from having more opportunities that can be facilitated by a gut that actually works and can absorb the fat to absorb, both the essential fats for the mitochondria, the vitamin A for visual processing, the B12, everything needs the gut to function, which is why I always sort of end up inevitably going back to the gut kind of over and over and over again. Is there any questions, Val? I know we have about 30 minutes left. I just want to make sure we kind of go through any questions in detail. No, it all makes sense?
Sorry, Peter, I think you're just on mute there.
The glutamate that you talked about, Dr. Sonya, is that the same glutamate that we find in MSG, the preservative?
I think it is. It'll definitely trigger glutamate. It's excitable, right? That's one of the other things in around the food additives is that they stimulate glutamate in the brain. There's a researcher, he's the one who actually proposed this term. The immunoexcitotoxicity is a proposed like central mechanism for autism and PTSD and chronic traumatic encephalopathy, the football. And so he actually has a book on, I think it's called Tastes That Kill. It's about food additives. And he's got really cool talks that you can find. You used to be able to find them just by Googling Russell Blaylock, but he talks about these studies that they did in prisons. And so one of the studies, they actually changed the diet and they reduced the sugar and the processed foods. And they saw a reduction in aggression in the prison. And then they also saw a decreased reoffend rate.
Wow.
So that's kind of neat when you think about like the brain and behavior in sort of a different lens. But yeah. So, I talked a lot about the philosophy, the theories. I know I did give you the information on the diet, but one of the hardest things in the older population is actually getting the stuff out of the bowel. So I want to show you my protocol for that. And let's see, here we go, pull it up. And then I'll send this to you. This is often why we need to try to get the bowel x-ray, because to get everyone on board with that, to get the doctor on board, to get the people who are having to deal with all this diarrhea on board, we need to understand what's at stake. So, if the behavior is wreaking havoc in a home, whether it's like a family's home or a group home, then there's going to be a lot of hard work that has to go into place to change that. And so diarrhea is not always possible, but it is a really great way to make this process work faster. So it can be any form of magnesium except magnesium hydroxide. Magnesium is an osmotic laxative. So again, it brings water into the intestines to soften the stool. And if you take enough of it, it will liquefy parts of the stool and it will come out as liquid. The other benefit of adding higher amounts in is that the only side effect of an osmotic laxative is diarrhea. So you're not going to get toxic levels of magnesium. The reason I don't say magnesium hydroxide is I just can't say incontrovertibly like that it's for sure safe at any dose. The others are 100% safe at any dose. The only side effect is diarrhea. If you IV magnesium, that is a different story. But keep in mind that our intestines are open to the world in two places, right? So the mouth and the bottom. If you IV, that's a closed system. So that means you could cause problems with the heart. That has nothing to do with oral magnesium, but that is a question we get. You cannot hurt anyone with oral magnesium. All you'll do is cause diarrhea. And in fact, the more diarrhea you cause, the better. One, again, because it's 18 to 22 feet long. Two, the pressure of more water is safe and it flushes out that sticky, gooey biofilm. So just like flushing a catheter, or I assume what happens to my engine when I get my oil changed, I've been told there's crud in the engine. So I think about the bowel and the crud in the bowel. You need to flush it out. And that's the other benefit of the fish oil, the cod liver oil, or any fish oil at a higher dose, is it acts like a detergent. If you've left a pot or a pan for days and it's crusty, you have to add a lot of detergent to get the crusty stuff off the pan. I'm telling you I live with teenagers without telling you I live with teenagers. But the fat itself can pull the sticky stuff off the gut wall. So if you've ever had someone take fish oil and aggravate, that's why. I built my practice on aggravations. It may surprise some of you to know that as an autism doctor, a naturopathic female doctor in Little Burlington is not people's first stop, right? So they try some of the big names first and they do a wonderful job, but I built my practice on people who weren't getting better with the usual interventions. And what I found is it's the sticky, gooey stuff in the gut. And then over the last 18 years, we've found that the gut is becoming more and more impacted. So I think, we used to get this sort of term autism light in Canada, which is awful, but they used to say it was easier to treat autism in Canada. And I understand why they said that now, although I still don't love that they said that, but it's that the intestines are more clogged now. So like before, you take a kid off gluten, they get better. Take them off gluten and dairy, put them on B12, it's like a way to the races. Now, you start fish oil, you aggravate. You start carnitine, you aggravate. You try zinc, you aggravate. Everything aggravates because that picture I showed you with the arrow right under the stomach, everything's going to aggravate if the whole intestine's full. So this flushing has transformed my success. I've had a few really cool cases of older, adolescents and young adults just really starting to move forward in exciting ways, but it has to be a lot of diarrhea. So the first thing I do is talk to them about, like, how long could you give this person diarrhea? And I was going to share a case with you. So I recently had a case, and the adult was pretty high functioning, fairly independent, and an incident took place where they threw something pretty heavy at someone else, randomly out of the blue, out in public. And so this high functioning, pretty independent adult, still living at home, but pretty good quality of life, like overall really happy. The social interactions were positive. All of a sudden, there was aggression that made it impossible for this person to be functioning in society. So they called me, and Peter sends me all kinds of tough cases that make me nervous, but so far a lot of them are getting better. God, thank God, literally. So we did some testing. First of all, his whole entire intestine's full. Okay, so we already know we've got a person where if we create some diarrhea, we might create some positive changes. But the other thing that happened is we did blood work, and there was wacky stuff happening in the blood work. For one, he was fighting strep. He didn't have strep. There's no sore throat. There's no fever. There's no, stomach pain or weird rashes that you see with strep. No peeling of the lips or peeling of the fingers and toes, right? But what's happening here? The antibodies against strep show that he's fighting strep. So strep will live in the intestine, as I mentioned in that earlier this morning. And so strep, when it gets out of control, can trigger autoimmunity, and that autoimmune attack can happen on the brain. It's called PANDAS or PAN, pediatric autoimmune neuropsychiatric syndrome. And so, abrupt changes in behavior or changes in personality really are quite medical. And I think they happen a lot without people investigating. So if someone says to you, like, this wasn't what my kid was like before, they used to be like this, and all of a sudden they changed, they were okay, and all of a sudden now they have OCD, or they have urinary accidents, or they rage, or their eyes look different, they look like a different person. It's like they're a different person. This is quite medical, and it's missed a lot. It can also lead to things like seizures. So anyway, what I say to people in this sort of realm is, how long can you keep this person with you at home and give them diarrhea? Now, if they have seizures, I have a little bit of a different conversation. But let's say in a non-seizure patient, can you keep someone home for 30 days and give them diarrhea? And a lot of times in those cases where it's gotten so severe, they have had to keep them out of society anywhere, keep them home from school, they can't go to therapy because of their self-injury, their aggression, their whatever list of things that are a problem. So 30 days of diarrhea is totally safe as long as people are taking a daily electrolyte. I'm not paid by anyone in terms of brands or supplement companies. I do run an educational platform called Exceptional MD, so you can see that that's a disclosure I should have given earlier. But these electrolytes you can buy, it can be sea salt. The other thing that happens in a chronically constipated person is they become very low in sodium. So if you have people who all they want is salt, they want to eat salt, they want to take it out of the salt shaker, they can't get enough salt. Yeah, run some blood work, make sure there's nothing going on. But a lot of times they have dysautonomia. Dysautonomia is the autonomic nervous system is dysfunctional. And so their intestines slow down to a halt. Their sensory system goes crazy. They may have endocrine or hormone issues. But one of the things that happens is that they can't get enough salt. So the more stress you have in the bowel, the more bugs and microbes you have in the bowel, the more likely you are to need electrolytes. And so we discovered this again in the last few years. The term is POTS for anyone who's sort of like wanting to look that up further, but POTS is postural orthostatic tachycardia syndrome, has nothing really to do with the heart. It's not super dangerous, but what happens is the blood volume is so low, sometimes your heart will beat fast for no reason. It'll also wake people up in the middle of the night. It's a reason. It can cause them anxiety, particularly if you couldn't talk to someone who's caring for you and your heart is racing. That's really stressful. So we've started actually checking O2 levels and heart rates in a lot of people now, and we're finding this more and more. Those people who can't get enough salt and they have really, really severe constipation, sometimes they also have POTS, and they do great with B12 and they do great with electrolytes. POTS also leads to headaches, dizziness, and nausea. I do have a little video to add in as a resource. It's a 20-minute of more of me talking. Now my sister does a lot of the talking, but Krista, my sister is a POTS expert. So she started treating this in her chronic infection cases where they had chronic infections like Lyme, now post-COVID, and things like pandas with the strep. So she's treating these folks and she's finding they cannot get enough sodium. So 30 days of diarrhea, totally safe as long as they get electrolytes, but you may also find the electrolytes become part of their daily life, improving energy, mood, bowel movements. The salt in here also helps to break up old stool, just like when, as Canadians, we throw salt on our ice, it'll help to break up old stool. So it's a wonderful addition to that, as are the enzymes, which I'll show you in just a second. So after the big bowel clear out, the first one, what I say is try to do a big bowel clear out whenever you can, and you continue doing bowel clear outs until your behaviors are minimized or hopefully gone. That has to be repeated typically over the course of years because the bowel is so long. And in a lot of your folks in the group homes that I'm talking to, like, it is crazy how constipated they are. It's just shocking. So some of the families will continue on weekends, but if kids aren't in school, they're not in therapies, or people aren't leaving and they can handle this, or maybe they're in diapers or pull up like that, we want to capitalize on trying to get as much out as possible. So again, my preference is fast and furious, as much as you can possibly get out. But of course, that has to be managed case by case. So this is confusing because we've highlighted part of this, but it actually all should be highlighted. If someone isn't taking the electrolyte, I want to keep a little bit closer contact with them, mostly in the little ones. Like if you have a 2-year-old and they have vomiting, diarrhea, they're not eating, and they're not taking the electrolyte, you might see an electrolyte issue. But other than that, we don't see electrolyte issues just inducing diarrhea. CHIO now, they're doing 3 days bowel clear outs. Here's another name that I'd love to connect with. If any of you guys can connect with this lady, her name is Gwendolyn Jane Roberts. She's a medical doctor. I believe she's a pediatrician, and she runs an elimination clinic out of Stouffville. And I think this clinic could transform the health of people who don't have access to people like me, because I am in private healthcare. That's a no-hip referral. You can get a physician to refer kids through the elimination clinic. And they're at least a group of folks who understand that the bowel is a problem and, leading to bladder issues, leading to problems with behavior and that kind of thing. So absorption, nutrient status. There are pills for people who can swallow pills. There are powders. Just ignore the natural care clinic stuff. There's supplements you can get off Amazon, online, in health food stores, in your health food section of your grocery store. Magnesium is easy to find. You can use peg flakes, you can use Restorelax. I don't think it's as safe if you start increasing the doses. It is a polyethylene glycol. Like, I get it's used all the time, but it is a petroleum product. So that I'll just throw that out as my 2 cents. Is it 2 cents at this point? It's got to be more than that. Okay, let's see the enzymes.
So Dr. Sonya, as you're pulling up your slide deck there's just a couple questions in the chat. One of them had to do with colonics. And what about treatments with colonics? Would something like that be helpful in removing that gooey, sticky stuff? And then we also had a question about Citramag.
Yeah, that's just using citrate, so that's totally fine. And colonics are totally safe and fine. And even sometimes you get someone to do them on kids, but they won't clear the whole bowel. So they won't clear under the stomach. And we did have we had a group of families that were friends. They all went to the same temple, and they actually did colonics with their kids. And it was fascinating to me because I said to them, I don't know if this will work, but it makes some sense and I know it's safe. So they did colonics for a long, long time. And some interesting things we found out. One, it wasn't enough. You have to clear the upper GI tubes. And I'm going to play a cute little video right now from a colleague of mine. But the other piece is sometimes it does get a lot of stuff out as an adjunctive treatment. So to do both. One of the naturopaths that I send these kids to, he's the only guy I know who does it. He's at Four Seasons Naturopathic. His name will come to me. I don't know. I always forget it. It's terrible. It takes some B12. But he saw one of our patients, and then the patient came in and the mom was like, Sonya, like there was sheets of mucus. The naturopath said there was sheets of mucus coming out. What do you think that it means? And I'm like, it's the biofilm. It's great. She's like, he said there were sheets of it. They kept saying this word sheets. And so I'm just imagining sheets of mucus. So then I got done work and I emailed him and I was like, hey, our mutual patient came in today and I have the permission to chat with you. I just wondered if you could tell me a little bit more about what you saw. So he calls me, he's like, Sonya, I've never seen anything like it. I'm like, well, you didn't let them know that you were quite so like shocked at it because they just found you really professional. But he was like, oh my God, there was so much in there. So enemas, colonics, bowel clear outs with a with a laxative. And then the other one would be enzymes. Enzymes, because they don't make enough of their own. So again, the only issue in here is if people can't take the ox bile because of the origin or because it's not halal. We are working on finding a halal source of it, but enzymes with ox bile. It's breaking up that sticky stuff right under the stomach so that when you're doing the bowel clearance, it's coming out. It's also how we got that child who had the big ball in the rectum, how we got that out without causing tearing or anything. Just break it down to sludge. That also, I don't know if that area is the only thing that causes eloping, but I'm finding that the more in the rectum it is, the more these people want to just bolt, the bolters. I think it's because in the rectum, like so many nerves in the rectum, it's got to be so uncomfortable. I had a mom not too long ago, she's like, I could see, because a little girl, she's doing enema. She's like, I could see it and feel the ball right above the anus, and it was stuck there. Imagine living like that, right? And we don't even know. So an X-ray is pretty easy to see if that's going on for some people. Not some people can't even lay down for an X-ray, so I totally get it. And what we do sometimes is something really silly called a beet challenge, or challenge basically to find transit time. So you get someone to eat beetroot, which is obviously purple, dark and purple, and you count the number of hours till it takes for that purple red stool to come out of the bowel. And if it's more than 24 hours, it's clogged. Sometimes you never see the purple red color because it's dissipated, just like if you took a beet juice and put it in your fridge, like by day 4, it's brown. So that's decent. Even purple dragon fruit, so purple on the outside and purple on the inside, that'll give you the same thing, corn, sometimes blueberries. But like the transit times in these folks is staggeringly slow. Was there more questions, or did I answer both of those?
Thanks. Those are both answered. Thank you. Just questions come up of, do we have a list of naturopaths that you'd recommend to work in Thunder Bay? And I know some folks have been working on that. So I don't know where we are with that. I know Maureen and Community Living Thunder Bay has been doing some great work and helping educate some naturopaths around the area, but I'm not too sure if we have any go-tos or if we're still kind of collecting that information.
Well, to my daughter's point, she thought that I had some sort of fancy treatment, and I don't. It's quite straightforward what we need to do. I have had the fortunate experience of working with many people and having great mentors, learning from people who've been practicing doing this for 30, 40 years. But what we're doing is actually not hard, and any naturopath can do it. So we offer through our educational platform no charge practitioner consults, where we actually consult with other naturopaths who might want to check in and see what we do. Dr. Wendy Edwards, like I said, is through Ontario eConsult. So there's lots of resources for people who have maybe spent more time in this realm, but there's nothing that I do that another naturopath can't do.
Thank you. Just another question's come up just as you were talking, I suppose, around the beet test. How long should it take ideally to pass the purple?
18 to 24 hours. And then you want to keep watching in case it comes out at 72 or it keeps coming out later. So I'll tell you, one of the cases that I mentioned with the bowel clear outs, one of the first clear outs that we did was 14 days, the longer ones, because we were doing the shorter ones, because Sid Baker, I'm not sure if you know that name, but Sid Baker is a physician who graduated from Yale. So he's an MD, and he became a functional medicine doctor. He's the first DAN doctor to defeat autism. Now, again, people don't always like that term, but lovely man, still practicing, I think. He's helped thousands and thousands and thousands of people, children, adults, other doctors, to learn how and what is going on in autism. Anyway, Sid Baker, I go down to, I think it was Dallas, I don't know, it doesn't matter. Georgia, I was in Georgia, and go in, it's Sid Baker, and I'm like, oh my gosh, this is amazing. He's like, the first thing you need to do if you're going to treat autism is figure out how much magnesium a child needs to empty their bowel. It's like, that is the weirdest thing I've ever heard. But he knew, right? He knew because he spent so many years, and it's even worse now. So we started with emergency clear outs, like when in doubt, clear them out. They aggravate, they regress, flush the bowel. But then what would happen is parents are like, after the bowel flush, they talk more, they're happier, they sleep better. So then one day became 2, and 2 days became 3, and then they became every weekend. And then not too long before the pandemic, I had a colleague send me their nephew, and they tried everything. They actually have 2 kids with autism. One, everything worked for, kids off to university this year, young man. But the boy, the younger brother, didn't work for, so he was still non-speaking, the behaviors that controlled the whole house. Everything was about the behavior, all kinds of issues. And so I said, listen, like at this point, I'll tell you, I don't know if it'll work, but give him diarrhea for 14 days. Keep me posted if anything pops up that's wacky. And so they call me about the 7-day mark. We jump on a call, and they're like, he's fine. But guess what? I'm like, what? They're like, he's pooping out toys. I'm like, what? He's pooping out little teeny tiny toys and elastics and like bits of stuff around their house. And they said, and we know it's been in there for years because we moved and we packed those toys away and never unpacked them because he kept eating them. And so then slowly he started getting better. Actually, he's talking more, and it's a long journey. This is not easy stuff, but it's the bowel flushing is very safe. It's very effective, and it's the key. It's the only thing I really can do in some of these patients, Peter, that you're sending me, because we can't get access to the gut tissue. We can't get them to absorb anything. But
Thanks for that, Dr. Sonya. Just another question's popped up just around the dye test as well. Just in the gut, what if the dye passes? What if the dye passes quickly before the patient? Could they still be blocked? Could the dye get around the blockage?
yeah, it's a great question, actually, and I should have mentioned that. We have a little picture that we show for this because this started happening, and we were like, "What's going on?" We were, it's like the kid who had a little bit of clogging in the gut, and then all of a sudden had the urinary stuff. It was, so what happens is it sticks to the gut wall. And you can see that the diameter of the tube is smaller because of all the stool that's stuck there. So these folks, it shoots out in like 6 hours or 2 hours. They'll be like, "Oh, we did a beat challenge. It was totally fine. It came out in 3 hours." And I was like, that's a clogged tube. And so we just keep doing it till this junky, gooey stuff that comes out. And I'll say to families, like, you'll know it's coming out of the small intestine because after the balls pass, because the pockets, right? The pockets in there that I showed you. But then the stuff in the small intestine is going to be gooey because it's not really formed into anything. So once that passes, it's in there so long, often it'll smell or look different or both. So I had one parent not too long ago, she's like, "Sonya, it was like a rotting dead horse." And I was like, "Well, I don't know where you first came across a rotting dead horse, but that is intense." So this stuff, once it comes out, is sticky, gooey. We had one family doing enemas. They were doing multiple enemas a day. Months later, we had the appointment, and they're like, "It came out, Sonya, and it was bark. Like, it was so hard. We couldn't dissolve it, and it wouldn't flush. We threw it in the garbage. It was bark." And this kid's behavior, I mean, he ended up punching in through a glass door and, shredding up his arm. Like the behavior is out of control, and it made sense, the intensity, because that bark was stuck to his intestine. Can you imagine? Literally every time he moved, it would have been painful. Or breathe, like anytime he took a breath, anything. So if there's not more questions, I'm happy to take any questions, but I was going to show you this little cute video here. Well, I think it's cute, but let's see here. I know you have to share so you guys can hear the music. There we go. I always forget that part. Okay. All right. Here we go. So this is what the mitochondria look like, sort of. I'm not going to share the whole video. I'm going to go to about here.
For example, vesicles destined to late endosomes are formed at the surface of energy stacks. With the help of clathrin molecules that assemble.
Sorry, one second. I'm like, what happened here? Because I played it before, then it went on to the next one, which is also an excellent one. All these little Harvard visions are so cute. But that's not the one I want to show you. So for you guys who, the naturopaths who watch this, if you guys have ever heard of Jeffrey Bland.
Mitochondria are organelles found in eukaryotic cells that play an important role in the production of ATP.
I don't think I've ever done this where I haven't done something super strange to it, so sorry about that.
Most mitochondrial proteins are transported from the cytosol into mitochondria. Translocator complexes. Interactions between these complexes bring
because it's just like some sort of text debacle
into close proximity. The successful targeting of many proteins that membrane space requires translocator complexes from both the outer and inner membranes. After entering the inner membrane, many of these proteins do not completely cross.
Okay, so here's the good
Reduced
stuff.
electron carriers are produced. Invaginations of the inner membrane, called cristae, contain 4 large protein complexes that harvest electrons from these carriers.
Like the 10th time the charm. Oh, I know.
Complex 2 accepts pairs of electrons from succinate and transfers them through a series of redox centers to coenzyme Q.
So it never works, and it's always like this. It's actually hilarious, but I think if I try to play the full thing, it doesn't show it. So I'm going to send you the video, and you guys can watch it yourself. The only time it did work is interesting to me because I was doing a little thing for the kindergarten kids over the pandemic. They asked me to come in as like a virtual speaker. And so I showed them this little video, and I swear it was the one time it worked. So there must have been some higher help there, but it shows sparks of energy essentially. And if you kind of take a look at that one, I'll send that one and the other one from Harvard. That's the way the cells function. And it's, that's what isn't working in autism. Like that, those cells are not functioning. And so everything in there is slower. Everything in there has dysfunction. And if you can improve cellular function, you can improve the organism, because we are just made of trillions and trillions and trillions of cells. And that's why I'm so fascinated, with this video that never really seems to work out. But maybe watch it for me, promise me.
Will do.
Yeah. And that's it. I think that's time, right?
All right, Dr. Sonya, that's just been excellent. I'm sure that everyone watching this now knows why we valued you so much for up to 10 years or thereabouts, and just the hundreds of families that you've helped. So what I'm going to say now, I usually take about a half an hour riff, so I'm just going to see if I can do that in about a minute, okay? But the big picture, those who work with me know where I'm going to go. Every problem in this case of enhancing the quality of life of people who we're supporting, let's say that's what we're about. Every challenge has either one or both of either a can't problem or a won't problem. And for those of you that watched this morning, if you don't take any of the suggestions that Dr. Sonya's made, if you're just saying, wow, that was awesome, but I can't remember anything, whatever, you've still been given an incredible gift. Why? Because the vast majority of problems that we see in terms of people not living to their fullest mind, body, and spiritual potential is not a can't problem. It's a won't problem. And if what you watched today motivates you to pick up the phone, call a naturopath, and that naturopath says, well, now where do I go now? Phone Dr. Sonya, or however you make it happen. The big thing behind what we do in these kind of seminars is to increase your motivation to just take the next steps. Don't worry about not getting the how-tos or the cans. that'll take care of itself if you just open your day each day with that high motivation to want to do it and make a difference in someone's life. So yeah, always remember the can and the will. That's what we're about here. Okay. And Dr. Sonya, I just can't thank you enough for the 10 plus years you've given us and continuing to give us, and for showing up and just doing such a great job here today. Okay. So thank you very much. And we'll be talking soon. Okay. Thank you. Thank you very much.